Here in Jamaica, we are sharing information and ideas which will be used by our colleagues from across the world. So it's a really very special time, and it's a pleasure to welcome too the folks that are joining us online as we move through day two. Day two has more panels, more information, more opportunities for ideas, but it also has a symbolic MOU signing, and we will be hearing from a representative of the World Health Organization as well. So it is my particular pleasure to welcome Mr. Dave Cliff, Chief Executive Officer of Global Road Safety Partnership, Mr. Paris Liawai, Chairman of the JN Foundation, Ms. Aggie Krasnolutka, Program Director of the FIA Foundation, Frank Fotia, President of Region 3 FIA Clubs, Delroy Simpson, Chief Technical Director in the Ministry of National Security here in Jamaica, Dr. Gary McKenzie, Assistant Commissioner of Police, and other members of the Jamaica Constabulary Force here with him, members of the Diplomatic Corps, international partners, regional delegates, other members of the National Helmet Wearing Coalition, stakeholders from the public sector, civil society, academia, motorcycle associations, road safety advocates, community leaders, media representatives, distinguished ladies and gentlemen all. Good morning. Now that I've gone through that long list, it applies for every other speaker after me. So speakers, you don't have to go through absolutely everyone. The welcome applies. To help put in context what we're doing here today, to remind those that were here yesterday, and to inform those that weren't, we're going to start with a recap of day one. Help me welcome the lead for youth and education programs in the JN Foundation and the driving force behind the National Helmet Wearing Coalition and this project today, Sydney Preddy.
Thank you so much, Paula. Good morning, everyone. Greetings to all and all courtesies observed. I will take the lead of our wonderful host that she has extended all the greetings to everyone here. So, first of all, let's talk about the National Helmet Wearing Coalition. So we fired up our engines, right, with a roadmap for 3 clear ideas that we want to empower. And they are to advocate boldly for standardized testing, to collaborate across borders for greater impact, and also to transform lives through policies that make certified helmet use the norm for everyone in Jamaica and regionally. So we thank you for joining us on our convoy yesterday and would like to share the highlights of the previous day with everyone here and online. Yesterday, June 19th, we revved up our engines and launched to cover 3 main panels of our 5 panels across 2 days. We went through 3 panels, but before the panels, we were given a few highlighted messages that I want to remind everybody of. We had Dr. Lucien Jones, Chairman of the Jamaica National Helmet Wearing Coalition and Vice Chairman of the National Road Safety Council, and he welcomed delegates from over 10 countries. He reminded everyone that motorcyclists account for more than 30% of Jamaican road deaths and 21% of global road traffic fatalities. Yet, certified helmets cut the risk of death 6-fold, serious brain injury by roughly about 3/4, and yet this still is not a priority, certified helmets. So next we had Donna Muirhead. She delivered remarks from the Minister of Transportation, Minister Darrell Vaz, calling out motorcycle-related deaths a national crisis, right? And she pledged that policy integration that links infrastructure, enforcement, and public education needs to be implemented. The message stressed that the need to block non-compliant helmets importation, harmonize standards across borders, and embed motorcycle safety in national transportation and also across public health agendas. Then we had Ms. Aggie Krasnolutka from the FIA Foundation, and she hailed the think tank of being the region's first First dedicated helmet forum, she cited fast-growing motorcycle fleets from about 3.7 million sales in Latin America, and over the decade, it is now going to about 5.6 million today. So we have a lot of motorcycles on the road, and we want to get helmets on all of these persons' heads, right? And she reminded participants that the region leads the world in rider fatalities. In fact, it's mostly men in their most productive years, and this would be age 19 to 29. So, following the messages, our first point on the journey was panel 1, and it was titled Understanding the Problem, Regional Perspectives on Helmet Use and Data. It also visited gaps in standardization. So we had legislators, regulators, and enforcers sharing their experience in Mexico, Belize, Guyana, and Jamaica. Despite contextual differences, all countries faced common regulatory gaps, cultural resistance, and also affordability barriers. We also shared enforcement struggles, and in response, many are adapting strategies, but there is absolutely a lot of room for collaboration as we have this shared cultural experience. So the next stop was panel 2, and this spoke to legislative and regulatory gaps towards regional policy solutions, and it aimed to align helmet legislation, regulation, and enforcement. So road safety champions from Kenya, the Dominican Republic, El Salvador, and Jamaica detailed the need for enforcement and the positive impact of same on helmet safety improvement. The issue is more than just enforcement, though. I promised you it is. It calls for legitimacy, trust, and also resources to ensure that all our enforcers feel empowered with the relevant capacity building initiatives so that they can properly implement enforcement, right? So the enforcers must be empowered, and so later today we will talk about that with the signing of the MOU. So our next idea is that laws must be backed by awareness, access to affordable certified helmets, and consistent enforcement. So although we are enforcing, we want to ensure that whatever we are enforcing, the motorcyclists are able to adhere to it. So our final stop for yesterday was panel 3, and it spoke to lights, camera, action, and storytelling as an effective strategy to drive advocacy, inclusion, and behavior change. We had avid storytellers giving us an exciting time yesterday from Trinidad, Jamaica, the UK, and the UK. They delved into an emotive presentation, stressing the need for messaging that connects with the audience, and also that provide impactful storytelling, which has been shown to cause positive behavior change. It emphasized that effective helmet advocacy must be humanized. Behavior change, when people come to see themselves in the message, they are more able to comply. Stories being told by bikers, for bikers, in their voice, carry more powerful impact than stories from policymakers and influencers. We were reminded that the best messaging comes from the streets and not in the boardrooms. So, thus far, we have come across 3 very well-lit and profound signs on our journey. Standardization is necessary. Standardization is necessary, but efficient enforcement of affordability of certified helmets and public education must support standardization. Next, another sign that we saw was regional collaboration is key. Countries want to move in the same direction, but if we share our resources and do our homework together, we can do way more than if we embark on this journey as individuals. Finally, people-centered change. Scientific facts are great, absolutely great, but those alone are definitely not enough. What we do need is cultural change. It is essential in driving helmet use. There are cultural nuances that would impact how we shape behavior campaigns across the region. So we urge you to continue with us today in discussions to advocate boldly, collaborate regionally to transform lives by improving helmet safety regionally. The end of day 2 should provide you a clear vision of the direction we should take together as a region to reduce motorcycle-related fatalities. Heads up and thank you.
Thank you, Sidonie. And now, ladies and gentlemen, it's time to hear from a man who has championed road safety for many years. He's the chair of the JN Foundation. Help me welcome Paris Liawai to the microphone.
Thank you, Paula. She woke me up this morning with the 6 o'clock news, and she's here bright and cheery again. I don't know how she does it. First thing I'm going to do is break your rule. I have to welcome Delroy Simpson, who is deputizing for the Minister of National Security. He's the Chief Technical Director, Ministry of National Security. My new friend, Frank Fortier, President, FIA, Mobility Region 3. My old friend, Aggie Krasnoluka, Program Director, FIA Foundation. Dr. Gary McKenzie, Assistant Commissioner of Police, friend of everybody. Mr. David Cliff, CEO, Global Road Safety Partnership. Ms. Claudine Allen, General Manager of Jane Foundation, and our wonderful, hardworking Jane Foundation team, panelists, moderators, all our partners and stakeholders in road safety, members of the media present, ladies and gentlemen, safety champions all, good morning. It really is indeed a great honor for me to be with you today as we formalize a partnership that marks a bold and necessary step forward in our national and indeed regional mission to improve road safety, save lives, and strengthen our communities. Although I wasn't here yesterday, I did take the chance to see a lot of the presentations on the net. And what struck me is that I got bored. I was hearing the same problems. Everybody had the same problems, which means also that we can find the same solutions, which is what we want to work on today. We at the Jamaica National Foundation, we take immense pride in our long-standing and productive collaboration with the Jamaica Constabulary Force. Together, we have delivered impactful initiatives anchored in 2 of the most critical pillars of national development: road safety and community engagement. Our shared commitment to reducing road crashes and their devastating consequences, particularly among motorcyclists, has led to the creation of programs that are saving lives and changing outcomes. One standout is the Road Safety Hub, developed through our partnership with the JCF Traffic and Highway Division. This forward-thinking facility is a multidimensional resource, a real-time data center, a space for community outreach, and a critical engine driving evidence-based policymaking and enforcement. Together with the JCF, we continue to lead national sensitization efforts, advocating for safe driving, helmet use, and personal responsibility on our roads. These campaigns are not only about reversing the troubling rise in road deaths, particularly among our young male riders, but also addressing a broader and often overlooked crisis. And I do say crisis, because media people, listen up. While fatalities grab the headlines, we must also remember and reckon with the thousands who survive crashes only to live with lifelong disabilities, spinal injuries, brain trauma, amputation, and the list goes on. These outcomes can be just as devastating. They rob individuals of independence, place an emotional and financial burden on families, and impose an ever-growing strain on the public health system. Each crash reverberates far beyond the crash scene. They go into the homes, hospitals, and generations. And that is why road safety cannot be reduced to infrastructure and enforcement alone. You hear, Gary? It's about people. It's about relationships, trust, and a shared responsibility for every life that lives through our communities. Now, this is the spirit. This is the spirit behind the National Health Wearing Coalition, and why we, especially at the JN Foundation, are extremely proud to host this two-day regional think tank. The active engagement of the JCF in this forum is both timely and critical. Their leadership reflects a deeper understanding that making our roads safer for motorcyclists and all road users require regional, as we have found out, regional and local action. Today's signing of this two-year training agreement is much more than a procedural step. It is a powerful statement which says that we are united in our commitment to protecting lives, strengthening communities, and building a safer Jamaica. We believe that this partnership will further empower the JCF to continue being a force for good, enhancing their capacity to enforce helmet laws, promote motorcycle safety, and uphold the standards that prevent needless tragedies. It also sends a clear signal that Jamaica is serious about reducing road trauma, not just through penalties and patrols, but through prevention, partnership, and people-centered solutions. To our partners in the government of Jamaica and the JCF, thank you for your vision. Thank you for your trust. Thank you for your tireless commitment to progress. And we continue to value the rock-solid partnership of the FIA. To Dave and the Global Road Safety Partnership team, welcome. You're joining a passionate and purposeful coalition of people who are deeply invested in ensuring safer roads and better outcomes for our enforcers and for every Jamaican. The JN Foundation stands ready to continue this journey with you, our stakeholders. So let us move forward with urgency, with purpose, and with unity to make our roads and our communities safer for all, with God's help. Thank you.
Thank you so much. We continue with remarks. These next set of remarks are going to be particularly referring to our landmark partnership that will be cemented here today. It's a two-year partnership, and our JCF will be empowered through capacity building to enhance their enforcement of road safety. And it is a partnership with the Global Road Safety Partnership. So help me welcome, please, the Chief Executive, Dave Cliff, to bring remarks.
Ladies, gentlemen, distinguished guests, hei aha te mai nui o te ao, hei tangata, hei tangata. Tēnā koutou, tēnā tātou katoa. So in the language of my homeland, which is Aotearoa, New Zealand, another Pacific island, what I said was, what is the most important thing in the world? It is people, it is people, it is people. And we heard that message from Paris this morning. This is about people. It's about the protection of people. And I think that's the most important thing that we remember as we continue to talk about how to protect young lives from being lost too early. A couple of reflections and stories, because I think storytelling is often the most powerful way of getting messages across. Between now and the end of this century, the projected sales of new motorcycles are estimated to increase from about 130 billion US dollars a year to over 270 billion. So if you think about the volume of new motorcycles that are about to enter the world's roads, and you think about the vulnerability of those riders, if nothing changes, this will increase the percentage that we heard of global deaths of motorcyclists from about 21% to about 26%. What's that going to do to the numbers? We estimate that the numbers killed will go up by approximately 60,000 per year. So it's never been more important to focus on those things that are killing so many and grievously injuring so many more. A couple of stories. When the government of Vietnam, who we work with, first started to really take the issue seriously, they turned up the penalties, they changed the law, and they directed police to really start to focus on failing to wear helmets. And I guess you can all guess what happened to the wearing rates. They went up. Fewer people were killed, fewer people were seriously injured, lives were protected. But there was a backlash, and the government sensed the backlash, and so they turned the volume of the enforcement down because they were worried about public sentiment. And I guess you can guess what happened to the wearing rates. They went down and deaths went back up. So we heard about cementing this virtuous circle of law, good standards, good and solid, rigorous enforcement, and the supporting education and awareness programs that back those things in a way that continue to reinforce one another are so important. People often think that culture change is achieved and then behaviour changes as a result. If we change attitudes, we'll change behaviour. It's a common belief, but it doesn't work. What we know from experience in so many areas of risk, in drink driving and speed, is that by enacting good law, enforcing good law, and supporting it with high-profile public awareness and education programs, we have to force a behaviour change. We've got to force the behaviour of wearing helmets to keep people safe. And when we do that, the culture and the attitudes shift in sync with the behaviour. It's a well-established set of psychological principles, because as human beings, we all suffer from this wonderful thing called optimism bias. It won't happen to me. I think we all believe that. And that's one of the key issues that we face with trying to change the behaviour of particularly young men. So really excited to be here. I apologise I couldn't be here yesterday because of missing a flight and having to come through yesterday afternoon. And as a result, also losing my bag, hence I'm now dressed, as you may have noticed, as a car salesman from the United States. But apart from that, I'm very pleased to be here and look forward to the rest of the day's deliberations. Thank you.
Thank you, Sir Cliff. And now, ladies and gentlemen, we hear from the police officer who is in charge of our nation's roads and making sure that we're safe. He's Assistant Commissioner of Police from the Public Safety and Traffic Enforcement Branch of the JCF. Help me welcome Dr. Gary McKenzie.
Thank you very much. Madam Moderator, let me say good morning to everyone. I will accept the protocols that have already been established. It is really a very good day for me to be here. I am looking down on the faces and I am seeing persons with the kind of commitment, the kind of, I would say, positive mentality, who believe that we can get our motorcycle drivers and travelers to wear helmets and be safe. Am I correct? That does not sound so. Am I correct? Good. So, the Jamaica Constabulary Force is indeed elated to be a part of the National Helmet Coalition and certainly the Wearing of Helmets program and initiative. Of course, this is something that is not domestic, it is not national, it is actually international. It is a challenge that we have all over the world as it relates to persons dying off motorcycles for various reasons, but certainly as it relates to not wearing helmets, this is a major problem. The Jamaica Constabulary Force has responsibility to ensure that persons drive from one place to another safely. Certainly, a part of that responsibility is to ensure that persons are equipped with the devices that they need to use or wear to get from one place to another. We have been plagued over many years as it relates to challenges with motorcyclists and pillion riders not wearing helmets. The following facts, of course, emphasize the challenges that we have had. For the past 5 years in particular, over 100 persons who travel on motorcycles have been killed in road deaths, and numerous other persons have been injured. When we check our investigations, we recognize that there was no evidence that over 70% of the drivers of motorcycles were wearing helmets when they crash. And there are several things that happen from time to time. When we have motorcycle crashes, when we go on the scene very quickly, there are times when we can be very definitive about what we say or what we find. But unfortunately, in some instances, motorcycles are moved, people are actually transported to hospitals and so on. And so we have had to do more investigations. And so a part of our investigations is to depend on our post-mortem reports. When we look at what we have been able to gather, over 75% of those persons who have died, the results have shown that they have serious head injuries. And this, of course, is indicative of heads not being protected when we have crashes. Based on these issues, it is very important that we understand that we have a serious problem, and we continue to do so. In fact, one of the things that we have to continue to do is to ensure that everybody understands the importance of helmets. And why I say this, a lot of times we tend to focus only on the motorcyclists or the pillion riders, but they are a part of our souls. They are a part of families. They are a part of communities. And so the message has to be holistic in nature. We have to get everybody to understand the importance of helmets. Helmets save life. In fact, wearing a helmet can significantly reduce the risk of head injury and death. And this is something that we have to continue to say. We have to protect our most valuable asset, which is our brain. And so we have to get this message out that whilst we are traveling on motorcycles, we have to ensure that we protect our heads. And I just want to give two quick personal examples. I have been driving motorcycle for over 30 years. And I remember two instances when if it were not for wearing helmet, I could have died easily. I recall I was driving a 900 Yamaha, and I was going through the bridge at Maypen, but it was rainy on that day. And a vehicle came through. That bridge is actually a very narrow bridge. And so I held on to the brake, and the bike slid. I was not in control because the handle slipped out of my hand. And so I slid, and I didn't know what happened. Only thing I hear was something like a gunshot. But it was actually the helmet hitting against the rail of the bridge. And I was unconscious for maybe about 30 seconds. I am that kind of person who I got up back and drive off the motorcycle again. But that was one instance. The other instance, I was on Mullines Road, and a vehicle drove out from Tarrant Drive into my path as I was driving the motorcycle by. Then I was driving a 1000 Kawasaki. And there was some gravel in the road unknowing to me. And so I grabbed onto the brake, and the bike slid, and I fell off right under a wrecker. And I was just in time to see the wheel rolling over towards my head. And as I pulled my head, the tire crunched the helmet as it passed. So, you know, these kinds of things, I am here to say that wearing helmet whilst driving motorcycle is quite critical. And so, based on international research, helmets can reduce the risk of head injury by up to 69% and the risk of death by up to 37%. And so it is very important that we understand that wearing of helmet is very important. This promotion of helmet wearing should not be taken lightly, should not be taken simply. It is a very, very serious thing. And certainly from my own standpoint, I am very happy of this particular program and initiative. And I really laud the efforts of all the individuals, the associations that are a part of it, to include our friends internationally. The importance of the multi-agency partnership should not be taken lightly. When we come together as a team and as people, we can achieve more than just one agency, one individual. We have to understand, and certainly from my standpoint, having been in the force for, over 3 decades, we have been prosecuting persons who are traveling on motorcycle without helmet. We have been seizing a lot because apart from persons not wearing helmets, a lot of the persons who drive these motorcycles, they are not maintaining them properly. And so if you check some of our stations, certainly my headquarters, I could open a major bike store because we have many of them seized there. And so we have been doing the work, but certainly it is important that we continue. It is important that we examine best practices, the best strategies that we can use. And so we, as a police force, we welcome Cliff capacity building, we welcome the partnership, and we welcome sharing of information. And I believe yesterday was very good. It would be remiss of me as a psychologist not to mention the importance of us simultaneously working towards encouraging a change of mindset and behavior. The responsibility of every person to ensure that they travel from one place to another, it has to be recognized. So whilst we have entities such as the police force, we have organizations who will seek to help persons to understand and to get them to do the right thing. The fact of the matter is that we have to start with us being responsible, knowing what we need to do to ensure that we are traveling on the road safe. But certainly, I will agree that law enforcement core responsibility is to ensure that the laws are adhered to. And we make no bones about enforcing the law. We always will need to do more, and we are committed to doing more. And so the police will continue to do its work around enforcement, around collaboration with key entities, and certainly through various types of interventions. And so, again, I want to say thank you to everyone who is a part of this initiative. A lot of agencies, a lot of persons who are showing the kind of interest, the kind of commitment that really reflects the need for us to take stock and to ensure that our brothers and sisters who are driving motorcycles, they are doing so safely and they are doing so wearing helmets, knowing that will help to reduce injuries and save lives. Thank you very much.
Thank you, Dr. Mackenzie. And now, ladies and gentlemen, it's time to hear from our parent ministry for the Jamaica Constabulary Force. You will see the Honorable Minister's name on your program, but as you may have heard, he's ably represented here today by his Chief Technical Director. So please help me welcome Mr. Delroy Simpson.
Well, the minister's representative does not get to break the rules, right, Paula? So I'm going to adopt the protocols previously established. Morning, ladies and gentlemen. Morning, ladies and gentlemen. Right, that's better. So this gathering is a testament to our shared commitment to addressing one of the most pressing challenges that we face as a country. We know about our crime challenges, but this one is also a pressing challenge. That is the alarming rate of motorcycle-related fatalities and injuries, particularly among our youth. Every life lost, every family shattered by a preventable road fatality diminishes us all, and that's how we have to see this thing. It's not us or them, it's every one of us. The safety and well-being of every citizen, and indeed every visitor to our shores, is of paramount importance. Road safety is not merely a matter of traffic management. It is a critical component of national security and indeed public health. Every life lost, every individual permanently disabled due to a preventable road accident represents a tragic loss to our families, our communities, and our nation's productive capacity. The statistics, ladies and gentlemen, while showing a decline in road fatalities, continue to paint a stark picture regarding motorcycle incidents. In Jamaica, motorcycle fatalities accounted for just over 30% of all road user deaths in 2024. While we have seen a 21% decrease in motorcycle-related fatalities in the first 5 months of 2025 compared to the same period in 2024, the numbers remain unacceptably high. The main victims, as you heard earlier, particularly young men aged 20 to 29, and this is within the most productive age range. These are our sons, our brothers, and really our future. Today, we gather not just as experts, policymakers, stakeholders, but as a united front, committed to turning the tide on this tragic epidemic, starting with the singular life-saving act of wearing a helmet. Research has consistent, it is a crisis that demands our collective and immediate attention. And this is what this forum is about. The government, in collaboration with various organizations, has implemented several initiatives to reduce motorcycle-related fatalities. These efforts focus primarily on education, legislation, enforcement, and providing access to safety equipment. The key initiatives include: 1, distribution of free helmets. The government has pledged to distribute 10,000 free helmets to bikers across the country. As part of this National Road Safety Initiative, my ministry has procured 2,000 helmets and has been actively supporting the National Helmet Safety Coalition in distributing them island-wide. While some progress has been made and helmets have been distributed in several parishes, there is still a far way to go to meet national demand and to ensure consistent access, particularly in rural and high-risk areas. This initiative remains a key pillar in the broader strategy to promote road safety and reduce preventable deaths. Second, intensified public education campaigns. Having secured dedicated funding, the ministry with responsibility for transport is intensifying its public education programs around road safety. This includes engaging experts to develop effective road safety campaigns and partnering, of course, with the JCF to enhance ongoing public education initiatives. The JN Foundation also uses creative methods like photo advocacy and visual arts competitions to promote helmet use among younger audiences. Thirdly, legislative and policy development. Significant efforts have gone into strengthening the Road Traffic Act and its attendant regulations, with specific emphasis on the safety of motorcycle drivers and pillion passengers. Amendments to the Road Traffic Act regulations included an increase in the fine amount from a paltry $500 to $5,000 for not wearing a protective helmet while operating a motorcycle. Penalties have also been included for the pillion passenger not wearing a helmet. Additionally, licensing requirements have also changed, as operating a motorcycle now requires a driving license and not just a learner's permit, as was the case under the previous iteration of the Act. Jamaica's National Development Plan. Just to give an indication of how seriously this is taken, Jamaica's National Development Plan, that's Vision 2030, also emphasizes promoting road safety and reducing deaths and injuries from road traffic accidents. And 4, and Dr. Mackenzie spoke to that, strengthening enforcement. So while significant progress has been made in strengthening the legislative framework around road safety, The government acknowledges that the need to enforce road safety laws more efficiently and effectively is of paramount importance. The move from a manual, paper-based system of issuing traffic citations to a new electronic ticketing management system at a cost of just about $1.1 billion has proven to be a game changer in supporting the JCF's efforts to enforce the Road Traffic Act. To illustrate, over the period January 1, 2025 to June 15, 2025, there has been a 42% increase in the number of tickets issued to motorcycle drivers compared to the same period in 2024. A 42% increase. So we're heading in the right direction, but more needs to be done. Additionally, overall ticket issuance has risen significantly, with 348,509 tickets issued for the period January 1, 2025 to June 15, 2025, representing an increase of 25,719 tickets compared to the same period in 2024. While progress has been made, with some encouraging declines in fatalities, more needs to be done to fully embed a culture of safety and ensure widespread helmet use in Jamaica. The National Helmet Wearing Coalition is instrumental in this regard. This event, bringing together experts and stakeholders locally, regionally, and internationally, is precisely the kind of collaborative platform we need, as it allows us to share knowledge and best practices. Learning from each other's successes and challenges is crucial to the development of effective strategies. Secondly, it allows us to advocate boldly for standardization and testing, ensuring that only certified, high-quality helmets are available and is used is non-negotiable. We have to go for that. We must align our laws with global standards and improve access to these life-saving devices. Thirdly, it allows us to collaborate regionally for greater impact. Road safety challenges transcend borders. By working together, we can amplify our voices and strengthen our collective efforts. And four, it allows us to transform lives through safe helmet use policies. Policy and regulation are powerful tools for behavioral change. We must explore how to better align our legal frameworks and enforcement mechanisms to promote consistent helmet use. The Ministry of National Security is committed to supporting initiatives that make helmets more accessible and affordable and strengthen the enforcement of our road safety laws in collaboration, of course, with the Ministry with responsibility for transport. However, we recognize that enforcement alone cannot achieve our objectives. We must complement strong enforcement with sustained education campaigns that foster a culture of safety. We must engage with our communities, particularly our young people, to shift perceptions and encourage responsible riding habits. I commend the dedicated individuals and organizations involved in the National Helmet Wearing Coalition. Your tireless work in promoting helmet safety through education, community engagement, and advocacy is truly commendable. The stories of those whose lives have been saved, we just heard a powerful testimony from ACP Mackenzie a short while ago, right? Serve as powerful reminders of the simple yet profound impact of this protective device. Let us use the insights gained from this think tank to develop a unified roadmap for helmet safety. Let us continue to foster a culture where safety is the norm, not the exception, where every motorcyclist understands that their life is worth far more than the cost of a certified helmet. Together, we can turn the tide against preventable road fatalities and injuries. Together, we can ensure that our roads are safer for everyone. Thank you, ladies and gentlemen.
And thank you, Sir Simpson. We don't want you to go too far because we're going to ask you to step up, actually. Ladies and gentlemen, we will now have the signing of the MOU for this Global Road Safety Partnership. And we are inviting to join Mr. Simpson from the FIA Foundation, Aggie Krasnolutska. Paris Liawai, could you also join us as well? And Sir Dave Cliff, Dr. Mackenzie, and Claudine Allen. Could you make your way to the stage for us, please? And this, ladies and gentlemen, the symbolic signing of the MOU, Global Road Safety Partnership, Jamaica Constabulary Force, FIA Foundation, and the JN Foundation. So hold on, all together signing, same time for the photo. May we have a round of applause for this symbolic moment. As we advocate, collaborate, and transform. Thank you so much, ladies and gentlemen. Thank you, photographers. Thank you, ladies and gentlemen. A round of applause again. Our next two speakers will provide the context for our first panel for today. That panel will be looking at the social and economic impact of motorcycle crashes and fatalities as barriers to development. We first have, through video, from the World Health Organization, the Director of the Department for Social Determinants of Health. A round of applause, ladies and gentlemen, for the message from Dr. Nan Tran.
Good morning, ladies and gentlemen. Thank you for the opportunity to open this important session on motorcycle helmet safety. This is indeed a critical and timely conversation. As you know, motorcyclists and users of powered 2- and 3-wheelers now account for nearly 1/3 of global road traffic deaths, with the burden falling heavily on low and middle-income countries where motorcycles are often the main form of transport for individuals and families alike. And in this context, helmet use remains the single most effective intervention to prevent death and serious injury in the event of a crash. But not all helmets are equal. Effectiveness depends on quality factors such as shell integrity, energy absorption, retention systems, and most importantly, proper fit, especially for children and smaller adults. Globally, 160 countries have helmet laws, but sadly, only 54 meet WHO's best practice criteria. And even where legislation does exist, enforcement and market regulation often fall short. In fact, in many countries, non-compliant, low-quality, or falsely labeled helmets are openly sold. Some are purely decorative and provide no real protection. To address this, we need to align laws with market enforcement through measures such as certification and labeling protocols, bans on uncertified helmets, public education targeting consumers and vendors, and of course, support for the supply of certified, affordable helmets. Alongside these helmet-specific actions, we must also address factors that reduce crash severity. Speed management, especially around child passengers. Lower thresholds like 20 to 25 kilometers an hour significantly reduce risk. Advanced braking systems such as ABS can reduce severity and should be promoted in policy and import standards. Safer road infrastructure, including designated lanes, traffic calming measures, and improved visibility. But we must also recognize that helmets are the last line of defense. Their impact is maximized only when these broader risks are tackled. And this requires a systems approach to road safety. A final critical gap remains: the lack of child-specific helmets, helmet standards. Children are not just smaller adults. Their vulnerability requires tailored solution. Yet to date, no country has implemented a national helmet standard for children, and enforcement around fit and comfort is minimal. So as you deliberate today, I urge you to think holistically, from technical standards to public awareness, from product safety to crash prevention. Together, we can chart a path toward helmet safety that is practical, enforceable, and rooted in the everyday realities of road users around the world. I thank you.
Following on the heels of Dr. Tran's message, we now have a message from the representative from the Ministry of Health. She is our Chief Medical Officer. Help me welcome Dr. Jacqueline Besesa McKenzie.
Good morning, ladies and gentlemen. Thank you so much for giving me the opportunity to try to help to set the tone for the next panel discussion on the social and economic impact. Road traffic crashes account for 10,168 cases that were seen in 12 hospitals across the island in 2023, according to our injury surveillance system. And this represented 25.8% of all injuries seen and was a 19.6% increase over 2022. That doesn't sound good. Road traffic crashes were the most frequent type of unintentional injuries, death accounting for 68.3% of deaths in this category. Overall, the rate of fatalities from road traffic crashes is about 14.2 per 100,000 population, and this is from 2022 data. Motorbike accidents account for about 29.1% of road traffic crashes and accounted for 38.9% of men that were affected in road traffic crashes and 7.5% of women. And we know that the age group that is mostly affected is a 20 to 29 age group. Motorcycle-related injuries in Jamaica are a serious health concern. There's a high incidence of accidents and the associated injuries. And these injuries range from minor soft tissue injury to severe injuries like head trauma, fractures, and, as we said, fatalities. Factors like helmet use, speeding, and adherence to traffic regulations play a crucial role in the severity and frequency of these accidents. There was a study done by Professor Crandon at the University Hospital of the West Indies that looked at 270 motorbike injuries cases between 2000 and 2007. And as we said, the most common injuries were soft tissue injury, where 100% of persons had soft tissue injury. And you can see, when you're on a motorbike, you're totally exposed. It's almost unbelievable that persons could put themselves at such a risk. You know, you don't have a car around you. We have enough accidents in cars. Then you can be just taken up and just thrown, where you can injure your head, chest, abdomen. Head injuries accounted for 53%, long bone fractures, 46.7%, abdominal injuries, 14.1%, thoracic injuries, 26.3%, and vascular injuries, 4.1%. The factors contributing to injuries are commonly the lack of helmet use, speeding, traffic violations, road conditions, and lack of training. The consequence of motorcycle injuries on the health system can be debilitating at times. Many motorcycle accident victims require hospitalization for treatment and recovery. Severe injuries often require surgery, including orthopedic, neurosurgical, and vascular procedures. From Professor Crandon's study, there were 195 patients needing surgical intervention in the form of orthopedic treatments, neurosurgical operations, abdominal operations, and vascular operations. The mean duration of hospitalization was 10 days. But we know that especially with coming out of orthopedic injuries, there can be several long stays on the ward from neurosurgical operations. Again, we can have quite a long stay, not just on the open wards, but in the intensive care and high dependency units. Motorcycle accidents are a significant cause of death in Jamaica, particularly particularly among males and unhelmeted riders. In the study mentioned, there were 12 deaths. 9 were due to traumatic brain injuries. Hence the importance of our discussion today on helmet use. Fatal injuries were more common in males and unhelmeted patients. So 10 of the 12 deaths were unhelmeted. Motorcycle accidents place a strain on the healthcare system due to the cost of the treatment and rehabilitation. Strict enforcement of helmet laws can significantly reduce the severity of head injuries. Raising awareness about safe riding practices and the importance of helmet use can help to prevent accidents. Addressing road hazards and improving road infrastructure can reduce the risk of accidents. Ensuring riders receive proper training and licensing can improve their skills and knowledge. Engaging communities in promoting road safety and encouraging responsible riding behavior is crucial. So I think the panel discussion and I'm going to allow the moderator to introduce the panel, but it sounds that we have some very esteemed persons who will be able to contribute significantly to the discussion on the impact, certainly in the hospitals, on the health system, and the economic impact overall. Thank you very much.
Thank you, Dr. Bisesa McKenzie. And so, ladies and gentlemen, as we move to a panel that will unpack the social and economic burden of motorcycle crashes in the Caribbean, we invite its moderator to come forward. Not only is he a vice president of the Public Sector Organization of Jamaica, but he's on the board of several public and private sector entities. He is an active and sought-after researcher. You may think his name is familiar, and that's because he shares it with his father. This, however, is the son. Please help me welcome a member of the National Helmet Wearing Coalition, Dr. Paris Liao, IE.
Morning, everyone. Thank you, Paula. All protocols observed, but I do want to single out some people in the audience. Colonel Price, I saw you a while ago running away. ACP Mackenzie, chairman of the GN Foundation, Paris. I don't know how to pronounce your last name. International and local friends who are here online. This panel is going to be discussing the social and economic impacts of motorcycle crashes. You know, when you look at the fact and the statistics that CMO Mackenzie mentioned a while ago, where injuries are going up, and you know, while fatalities are going down, ACP Mackenzie, we realize and understand that fatalities is one end of a chain of events, beginning with environmental conditions, physical conditions, traffic conditions. Then you have a crash. A crash leads to injuries, a crash leads to death. But a crash also starts another chain of events, from investigations by the police, by insurance agencies, by lawyers. It also sets off a chain of events in terms of hospitalization and care. It sets off a chain of events with individuals and families. So it's a very serious and complex issue, and we are going to dive into this in the panel. We have a distinguished panel. We have Dr. Rory Dixon. Can I invite Dr. Dixon to come to the panel? I'm going to introduce you. He's a consultant orthopedic surgeon and senior medical officer at the Sir John Golding Rehabilitation Center, specializing in spinal cord injury, amputee care, and sports medicine. He has 30 years of experience in orthopedics. He's an advisor to the Jamaica Paralympic Association and international classifier within the International Paralympic Committee. supporting events in the Americas and Europe. Welcome, Dr. Dixon.
Thank you.
We welcome Dr. Kerry Fletcher, my good friend Kerry, orthopedic surgeon from St. Anne's Bay Regional Hospital, injury advisor to the National Road Safety Council. He's a committed researcher and advocate, publishing over 20 papers on motorcycle and pedestrian injuries, and has received awards based on his study on motorcycle injuries. He's also a member of the Jamaica Orthopedic Association. Welcome, Dr. Fletcher.
Thank you.
Welcome, Ms. Adrienne Pinnock, corporate communications and PR manager at the Jamaica Council for Persons with Disabilities, with over 12 years of public service experience. Her work focuses on advocacy, inclusive communication, and public awareness for persons with disabilities. She has led strategic negotiations, developed accessible communications technologies, and managed social media campaigns aligned with national objectives. Welcome, Ms. Pinnock. And finally, we invite Ms. Yelisa Mendoza Rodriguez. She is a road traffic safety analyst at Intrant and traffic engineering consultant in the Dominican Republic. She has experience in traffic impact studies, road safety assessments, and transport modeling. I conducted a lot of research on public transport accessibility and traffic management in Santo Domingo, holding an MSc in civil engineering from University of Wolverhampton and a BSc from Intech, India. Welcome, Yelisa. So, colleagues, we're going to kick things off. We're going to...
From the seat of the area that many of us do not hear about. We only hear about the statistics, the numbers of persons, well, the number of accidents annually, number of deaths. But with each death, there is a significant amount of morbidity, and morbidity in terms of spinal cord injuries, amputations. People not only die in accidents, they injure their spinal cord, they lose legs, they lose arms, and in some cases they get traction injury to their upper limbs, so they have brachial plexus injuries. And these persons, they're not so much on the forefront, but we see them on a daily basis at the Surgeon Golden Rehabilitation Center. For those of us who are not familiar, the Surgeon Golden Rehab Center is the only public center of its kind in Jamaica. And it started in 1954 with the outbreak of polio. But since the eradication of polio, we now deal with mostly persons with trauma. So usually for motor vehicle accidents, that's high on the list for persons that we see. And of course, this would include persons who who drive motorbikes as well. The figures that we have are confined just for the center, because we are working on establishing national registry for primarily or amputees, and by extension spinal cord injury and other things. So in keeping with the recommendations or the requirements by WHO, we are in place to have our data collection in good order soon. So just to give a profile of the persons that we see, it's usually a young male, and in taking the history, we usually find out that they're helmetless, not wearing any protective gear. In other words, no jacket, they're usually in shorts, wearing slippers, no helmet. Sometimes they have passengers as well. And in some cases, they may also be under the influence. And this is a typical profile. And as mentioned before, they tend to be in the young working class age group. So for us, it's the range that we see is 20 to 60, but mostly the younger persons. And all right, so this is just showing us the age group that we see typically. So when there's an accident, depending on where you crash, it has a significant impact on to when you get treated. So there are different grades of hospitals based on the services that they provide. So there's type A, which is like a Kingston Public Hospital, and type C, which are like a Linstead Hospital. So the services that you may receive are determined by the expertise that's available. So if you crash, for example, down in Westmoreland, based on the figures that we look at, it may take you about 6 days to get surgery if you end up immediately in a type A hospital. If you need to be transported into either Kingston or Corner Regional or University Hospital, it may take about 2 weeks before you actually get surgery. And after surgery, it may take another 1 to 3 months before you actually get to the surgery and go to rehab hospital for rehabilitation. And that is because our bed space is very limited. Our capacity has not increased since 1954. And we are now in the spotlight for expansion. We are proposing to build a new wing to host 30 more beds. So, as mentioned, the waiting period may be 1 to 3 months. And we always have a waiting list for persons for admission. What is the implication of this? In addition to your injury, you can now develop certain complications. And I will go back on just to, well, I think we can look at, I can show this one. One of the issues that we have is that persons develop what we call bed sores or decubitus ulcers. And these occur very quickly. You can develop a decubitus also within the first couple of days of injury because most of these persons with spinal cord injuries, they have no sensation. So they cannot, for us, we shift ourselves every so often when we sit to take the pressure off our pressure areas. But persons with spinal cord injuries, the skin begins to break down within 2 hours of sustained pressure. And unless they're turned every 2 hours, which is the standard, they end up with these massive ulcers which complicate their rehabilitation, because in addition to rehabilitation, we now have to do wound care, plastic surgery gets involved, and the period of hospital stay, which for somebody who is paraplegic, it's usually on average 3 months. It can extend to up to a year sometimes because we have to deal with wound care. Although okay, so most on looking at the persons that we admit, about 60% of them are admitted with bed sores, and I mentioned before the implications. Other complications persons develop while waiting for rehabilitation. They can get contractures of their limbs, they lose a lot of muscle, they can develop pneumonia, infections involving the urinary tract. They can get deep vein thrombosis or clots, and some of them actually die before they can be rehabilitated. And as mentioned before, the length of stay can be prolonged depending on their comorbidities. And the cost of care is compounded with wound treatment, because some of these wounds have to be dressed twice daily. And it's manpower, it's also disposables, gauze, dressing solution, bandages, and this increases the cost of healthcare. And of course, for rehabilitation, it's a multidisciplinary treatment, and persons have to be retrained how to take care of their bowel, their bladder. Of course, prevention of complications is part of the rehabilitation. The need for assistive devices, the wheelchair, which is seemingly common, or it is taken for granted that it should be available for persons with spinal cord injuries. There's actually no system in place to present persons with a wheelchair during their rehabilitation. Most of our wheelchairs we actually get from donor agencies, and this is an area that is lacking in many countries when we look at the wheelchair statistics. There is, keeping in mind that these patients are young, productive men, we also have to take care of their psychosocial and their sexual health. And this is also part of the rehabilitation service. So we're looking at our typical male who was usually working, has a motor vehicle, has a bike accident, and he's out of commission for a long period. We can just see the drain on the family and the community in general when we look at all the factors that are involved. And we also look at the social aspect in terms of the support that these persons have. And in one of the studies that we did for persons discharged after treatment, we see that most of them actually do not end up being income earners after discharge, because they're usually manual laborers. And so there's a significant gap where this aspect is concerned. And of course, reintegrating back into the society, we find that when we interviewed over 100 patients, we find that many of them are confined, and they don't actually get to go out in the community as much. So that's another significant impact. Because healthcare beyond your injury, we need to remember that for the men, they need to still take care of their prostate, still care of their general health. So, and persons with spinal cord injuries, because of the decreased activities, physical activity post-injury, they have a higher risk of other non-communicable disease, hypertension, diabetes, obesity. So these are some of the factors that we need to bear in mind. Thank you for my brief presentation.
Thank you very much, Dr. Dixon. I'm going to move to Dr. Fletcher now. Your presentation is going to be on the human cost, trauma care, family impact, and loss potential. Dr. Fletcher.
Good morning, everyone. Thank you to the organizers for allowing me to present today. I'm looking, the presentation was sent. Okay, so while I'm waiting on the presentation to pop up, I'm an orthopedic surgeon at the St. Anne's Bay Regional Hospital. So my interest in motorcycle injuries come from the fact that I've had to treat the numerous motorcyclists for limb injuries and spine injuries predominantly. So while I don't directly treat head injuries, I co-manage them with my general surgical colleagues. So I'm going to be presenting data from research that I had conducted a few years ago over a 2-year period in which we had looked at 155 motorcyclists who had presented to the accident and emergency at the Sentence Bay Hospital, either directly or they were transferred from another health facility, most commonly from the Northeast regional area. The ages for these persons ranged from 14 to 64 years of age, and the average age was 28. Not surprisingly, the persons in their 20s made up the majority at 47%. So when you look at the occupations of the persons, it was mainly persons with manual jobs. These slides are not in the order that I sent it. But these were mainly manual jobs, and they had an 88% employment rate. Now, in terms of the common body areas involved, it was predominantly the leg, ankle, and thigh. And regionally, it was the lower limb injuries that predominate. Now, for the non-medical persons, the lower limbs are from the hip to the toes. The upper limbs from the shoulder to the fingers. So it was 55% of the injuries involved lower limbs, 35% upper limbs, and we're here mainly because of head injuries. That's at 31%. Now, in terms of who wore a helmet at the time of the crash, only 29% of the motorcyclists were wearing a helmet at the time of the crash. Now, very importantly, why weren't they wearing a helmet? This is one of the advantages of doing research in real time as opposed to retrospectively, so you can find out what exactly causes people not to wear helmets. So we found that just over half of them, the reason was that they were traveling for a short distance. Now, this publication in which this figure is quoted has been cited 4 times, and authors, therefore, from other countries have found the same thing. So I believe that this is one of the emphasis that we need to put in our public educational messages. We need targeted messages, and so simply saying helmet saves lives is not going to be sufficient. Now, 29% of them did not own a helmet, and the commonest cause of this was either the cost of the helmet or the fact that they found helmets to be uncomfortable. The next common reason was that females found, well, in their opinion, they did not want to spoil their hairstyles. Only a quarter of our riders had license and insurance. We were looking at this to test the roadworthiness of the rider to see what type of thing that they have. So, warning, this was really for a medical audience, so for the persons who have a weak stomach, feel free to look away from the monitor for this upcoming injury. This is a type of injury that we can see as an orthopedic surgeon, not uncommonly. This person will need an initial surgery to wash out this, get out the dirt, grass, the debris, resect muscle that has been badly damaged, then have a second washout to make sure that you got rid of all of the contaminants, then a third procedure to fix the bones with various metallic instruments, and then a fourth procedure which would involve plastic surgeons. And this is assuming that all goes well with each procedure and there are no complications. Now, shorts and slippers is one of the things that has become a major problem in our patients, and one of the things that I've been advocating for is legislation in terms of not just helmets but lower limb protective gear. I understand, as presented earlier, that there is a fear of backlash from voters. So if we're concerned about backlash and we want to at least strike a compromise, we need to at least enforce that persons cover their skin with long pants and their feet are adequately covered. We have numerous cases of persons losing their toes to amputations for these various injuries. Warning, another picture is coming up. So this is a situation with shorts and slippers. This person has a mangled foot in 2 areas, and some of you therefore would not even realize his thigh bone is broken as well. So, back to helmets, the reason why we are here. The age group that most frequently did not wear a helmet were the teenagers, 92% non-compliance rate. However, the group that I'm particularly interested in are the persons in their 20s, simply because of the volume in terms of the fact that they were 47% of the study population. 81% of them did not wear a helmet. So what does that mean? Our public educational messages also need to use language that the young people are going to understand, and we need to have messages that they are going to identify with. Now, another group that we need to look at are the passengers. If you notice in this picture, this person's helmet is protecting her rear end as opposed to her head. Now, none of the passengers in my study were wearing a helmet. And this is in keeping with what our road safety unit found, that in their study, only 1% wore a helmet. So we also need messages targeting the passengers. We also need to look more carefully at why it is the passengers aren't wearing helmets. I'm sure a lot of times it's that they don't own it or their age, etc. But this is something that needs to be looked into. Now, importantly, 90% of those who sustained a head injury were unhelmeted. And not only that, those who had severe head injury, those were the ones that tended to be unhelmeted as well. Those that required transfer to a larger institution, most of them, if not all of them, did not wear a helmet. Now, the persons who were more likely to wear a helmet were the older persons, but also those who rode a larger motorcycle, and we're defining a larger motorcycle as an engine CC rating of greater than 150 cc's. You were 3 times more likely to wear a helmet if you rode a large motorcycle. I think this is multifactorial. One is that older persons tend to ride the larger motorcycles, as well as the fact that there is a perception that you're going to get worse injuries if you're riding a motorcycle that's large and it crashes. Interestingly, those with a license and insurance had an overall 57% compliance rate, which is almost 2 times the overall compliance rate. So if we can improve on our license and insurance rates, we can possibly improve on helmet compliance as well. Those who are taking risks are uniformly taking risks is what I mainly took from that finding. So in terms of analyzing the mechanism of injury, how did the crash take place? Almost half of them were involved in a collision, almost 40% loss of control, and loss of control was multifactorial. It was either one or more of the following factors: speeding, a wet road, or poor road conditions such as gravel and potholes. And of course, errant overtaking was a factor. But this is the most important figure as far as I'm concerned. 80% was without question highly preventable, and another 8 or 9% likely preventable. Had they been formally trained, when you look at the mechanism of injury, chances are most of them would not have had this crash. But how many were formally trained out of the 155? Only 3 were formally trained. And if they were trained, chances are, and the thing about it, but none of the 3 were the typical Jamaican citizen. One was a policeman, one was a Canadian tourist, the third one rode at Dover. This is a typical, this is a snapshot of the admissions that we've had at the St. Anne's Bay Hospital at a given time. They accounted for 25% of the total admissions at the hospital. All of them were unhelmeted. The first one was speeding and collided with a truck. Those were his injuries. Second one, overtaking, collided with a car. Those were his injuries. Third one, speeding around a corner, collided with a part truck. Next one, speeding and fell off the motorcycle. And the last one, speeding and ran into the back of the car. So this is what I'm dealing with at a given time on a ward round at the hospital. And these are some other injuries. So what determined the need for admission? The more body parts that were affected, the more likely you were to need admission. And also, if you consumed alcohol within 3 hours of the crash, you were 3 times more likely to need admission. And put another way, 84% of those who consumed within 3 hours of the crash required admission to hospital. And of course, admission speaks to the severity of the injuries. Approximately 75% of our patients required admission to hospital. And those who needed surgery, 53% of the study population. When you compare that to previous studies that involved all road users, only 19% required hospital admission. The areas that most likely needed surgery, the leg, the ankle, and the thigh. So there are numerous costs that we still have unaccounted for in the health service, which needs to be looked into. We need a dedicated team that looks at cost. And so I was not able to look at cost in this great detail. Not only are these persons the main breadwinners of the family, and so there is a cost to the family from just the lost income, and many of these bones take 6 weeks or greater to heal, let alone the time that they're going to finally walk again. There's also grief, which is a major social cost that is unquantifiable in many cases. Damage to other vehicles and infrastructure are other considerations that need to be looked into. So what did I look into? Well, the loss of earnings. These persons earned an average of $30,000 a week, and the cost of the average motorcycle was $120,000, so 1 month's salary. These are figures from another study. So in terms of recommendations, we need to look at the typical rider who is a non-recreational rider, who is less than 40 years of age. We need to focus on those particularly in their 20s and 30s. Riding for a short distance is something that we need to emphasize in terms of our messaging. The shorts and slippers, we need to do something about this because this is accounting for severe injuries. Also, I should have mentioned earlier that only 1 person had died during this study period. And so with motorcyclists being the #1 in fatalities in terms of our road users, what we need to therefore look into are the persons who are dying at the crash site. So we need to do toxicology screening to look at the cause of death, because the majority of the deaths are not occurring in the hospital, but at the time of injury or on the way to hospital. We need to look at the pillion riders, as mentioned before, and we also need to ramp up the alcohol testing, because in addition to what I presented earlier, we also found that you were 4 more times likely to crash on a public holiday as opposed to a weekend, and a lot of that is related to alcohol consumption. Also, in the months of December, 40% and 50% respectively of the persons who crashed in those months had consumed alcohol near to the time of crash. We need island-wide formal training, not only to improve the skill level of these riders, but this is where we can change the mindset of our riders. This is where we can hand out helmets. This is where we can get the licensing and other things sorted out. We need to improve on the literacy of the riders because a number of them are illiterate. That is something that we found. Assessment of helmet standards is something that the Helmet Coalition, which is where I'm a part of, is looking into as well. Now, in terms of medical record digitalization, this is taking place at a few hospitals, and we need to further enhance this. We need to further enhance data entry, because there's a lot of data entry that is unreliable and is missing. When we look at the cost of care study that was done in 2017, there were certain parts of it where there was 40% missing data. So that is something that we have to improve upon. Without the data, we can't get informed from the information. We know our moderator knows the crash map data very well, as he's the producer of it. I think we need to utilize it more and combine it with the various cameras, including the NWA, Jamaica Eye, various mobile apps, so that enforcement is more dynamic in nature, and we have less of the static policing where they can simply ride past the police stops. We need to ensure that motorcycles are sold with helmets, and very key in terms of my research, education in high-volume motorcyclist areas in conjunction with media promotion is very important. So whether it is that the motorcyclists gather at parties, football events, we need to go to them and get the message across to them. Sustain targeted messages from some of the things highlighted in this presentation. We've recently gotten breathalyzer testing kits from PAHO, which we're very grateful for, because breathalyzer testing needs to be ramped up, and as I mentioned earlier, toxicology screening for the fatal cases. Comprehensive approach by stakeholders across the width of society. Well, hopefully the Jamaica Helmet Coalition Committee will deal with that as well. Thank you very much.
Thank you, Dr. Fletcher. Again, very important visual presentation. We're going to move from the medical to the post-medical. And then, and Ms. Pinnock, you're going to speak about the overlooked outcomes and disabilities as a result of road trauma. So, Ms. Pinnock.
Good morning, everyone. The Jamaica Council for Persons with Disabilities is the national authority that seeks to serve persons with disabilities. We are charged with the responsibility to promote and to protect the rights of persons with disabilities. But in context of the discussion that we are having, the challenge that we have as a country is not only collecting the data, but utilizing the data and sharing the data across the ministries. So you will find that at the public health front face, a disability is identified, but then there is no knowledge about the Jamaica Council for Persons with Disabilities, the services we have to offer, and how such an individual is supported to be reintegrated in society. Because acquiring a disability is a whole new frontier in now being reintegrated, especially when such a disability is acquired at certain age group. And we're looking at the younger group of persons. How do you now face the accessibility barriers in terms of accessing now education and accessing employment with the acquisition of new disabilities? Then there is another side to the conversation when we look at what are the financial and the economic strains now on society when a disability presents itself. The limitations of services becomes one challenge a person's face, where if we look where the concentration of where the accidents are happening juxtaposed to where the services are, you can easily identify the challenge. So the western side of the island is where the prevalence of the accidents may occur, but all our services, or majority of the services, are in the Kingston area. The head office of the JCPD is in Kingston, but we too have our limitations in serving island-wide in terms of providing that social and rehabilitative support that will help the individual to be reintegrated. We also find that there is still stigma attached to disability, and even though we have worked in terms of public awareness and education, persons still have some level of stigma. So you find the conversation now of suicide and that type of angle sets in when the rehabilitation and the support is not provided or is not easily accessible to the individual when the disability is acquired, because of the stigma and sometimes the fear of how to enter now this new space in terms of navigating life. The abandonment of family because of the financial burden is also a factor to consider as we have this conversation in terms of what occurs when the disability presents itself for those who survive the accidents. So the families tend to abort mission because of these constraints that exist. You're talking about now when a wheelchair is involved, the limited access we have to public transportation that is accessible. So now we're facing a cost now of chartering public transportation to access a service that is 4 parishes away in some instances. And you find that it's a whole week's wage just to access public health service, and you may need the service for more than one time for the week. So families are not always in a position to support, and the easiest option is to abort mission. So those are some of the factors when we look as an organization that we are facing, and public awareness will support us. But what another reality is that the disability is already here. So we now have to strengthen the systems that exist, that we are supporting persons, that they can be reintegrated and add value to the society, because a disability does not prohibit an individual from adding value. Once the support and the rehabilitation occurs, then there can be economic value that is added when that person is reintegrated in society. Then we look at, well, I mentioned the psychosocial impact and the policy, the strengthening of policy that needs to happen. We have legislations that are not speaking to each other. There is a Disabilities Act that is in full effect that requires of us as a nation to be accessible and these services to be provided. So as we navigate our policy framework, we must look at what legislations that are in place and ensure that we are compliant and our policies are not only tabled, but they are fully implemented and effective so that they can have the impact on the society that they ought to have. So those are some of the areas we ought to consider when we look at the space of disabilities: data sharing, then utilizing that data to make or design programs that are impactful to the needs of the persons that are facing the challenges, and then position the services where the needs are. So it's not only creating those services, but ensuring that they are accessible to the people and they are where the people will need those services. And I think I will leave my discussion there until we get now to the question and answer.
Thank you very much, Ms. Pinnock. And finally, we have Yelisa. I'm going to speak about the post-crash legal gaps and the economic impacts in the Dominican Republic.
Physical effects, financial, etc. Physical effects, financial, etc. You can also have emotional trauma. In the case of the Dominican Republic, for example, we don't have a measure of the damage that's caused due to these traffic accidents to infrastructure, and we also don't charge it to the person that caused the accident. So in the Dominican Republic, we do have a rough estimate of the cost of healthcare costs of traffic accidents. So, So we estimate that 2.5% of our gross domestic product is spent yearly to treat these over 100,000 injuries and 3,000 fatalities, which is around $3.4 billion every year. In the year 2023, our main traumatological hospital of Santo Domingo, which is Ney Arias Lora, reported that 65% of their budget was spent on treating these victims of road traffic accidents, with an average cost for patients that present polytrauma, an average cost of $2,500 to $3,500. Each day of ICU care ranged between $10,000 to $11,000. And for lower injured patients, it ranged between $300 to $600. But this is just the care the cost of care up to discharge from the hospital. So the director of this same hospital, Ney Arias Loras, reported in 2024 that around 28% of all road traffic victims are left with permanent injuries, that this could range from residual pain to maybe a permanent injury, etc. But we don't calculate the cost of the follow-up treatment of these patients, the rehabilitation, for example, emotional treatment, etc. We don't calculate or take this into consideration. So one new initiative that we're trying to begin is to provide assistance for victims of road accidents. After signing the Presidential Decree 65624 in November of 2024, national road safety was declared a high priority, and we established the process of elaborating and implement a national strategic road safety plan for 2025 to 2030, with the main goal of reducing traffic deaths and injuries by at least 50% by 2030 in the Dominican Republic. But also one of the immediate initiatives of this was to create a Department for Assistance to Victims of Road Traffic Accidents to provide legal and psychological support to victims and their families. So this Department of Assistance to Victims of Traffic Accidents is meant to guide and assess people affected by road accidents, offer personalized and professional care after the incident, and provide social and emotional and legal support for these victims. So one of the main points here is guidance and assessment, personalized and professional care, social and emotional support, legal guidance, and coordinate with other services. So we have to coordinate with other emergency and medical services so we can refer these victims to receive the proper care. So the services will be provided in person and also virtual assistance. The first unit is almost complete. It's being placed in the main headquarters of Intrant in Santo Domingo. But we will provide as well virtual assistance. We will have a call center to be able to provide service for people in the other provinces. And this will serve as a pilot project, which we hopefully will expand.
What has been your experience and the experience of your colleagues in dealing with the families of victims throughout that rehab process?
Okay, so there's so much importance of the role of the family in persons with, after injury. So much so that before a person is admitted to the hospital for rehabilitation, we actually require that the family comes to the clinic with the person, and we do a comprehensive social assessment, because what we want to do is to ensure that this person has the support while he's in hospital, and also will have the support when he comes out of hospital. And unfortunately, persons will say what you want to hear, and what we get sometimes is, so there is a lot of support initially, and then after the person is admitted and they see the impact of what is going to take long term, we find that the visits get less frequent, and after a while, when it's almost time for the person to go back to their home, we hear many things. The caregiver has disappeared or migrated, or the house, they have lost the house because being the sole breadwinner, they're unable to pay the rent. So this person ends up being in our care indefinitely until something else can take place. So to reduce the incidence of this, we have what we call a family conference during the period of stay, in which the family is brought in. We do a group discussion with the different caregivers, the physiotherapists, the psychologists, social worker, the medical persons, to give the family a more, to keep them up to date as to what the rehabilitation progress is, how it's coming on, what to anticipate with the injury, how they can provide support and continuing support. And so the family conference is also a way for us to establish that the support is there. And as part of the process, we also do home visits. So we have a team that we also have occupational therapists as well as a physiotherapist, nurse, medical team. We go to the home, we check to see what the accessibility is, because many of these persons live on a hill which is not wheelchair accessible. The existing house usually does not have the required parameters to allow entry of a wheelchair, things like that. We have to go in and make recommendations for adjustments to the existing kitchen structure, bathroom structure, things like that. So it's a very comprehensive process.
Can imagine. Thank you, Dr. Dixon. Very quick question, Dr. Fletcher. You mentioned the alcohol component of injuries. What about drug use?
Drug use meaning marijuana?
Marijuana.
All right, so I get the question almost routinely. What has happened is that, first of all, the study was conducted in a situation where there was no objective testing, whether it be breathalyzer, blood alcohol levels, anything like that. So if you notice, I have to present the findings very carefully in terms of consumed alcohol within 3 hours. So with the absence of objective testing, I then have to rely on subjectivity. So it was much easier to interview someone and get a change in their cognitive function, their various impairments, perception, after drinking the alcohol. It was easier to elicit that than a marijuana smoker. Our marijuana smokers tend to smoke throughout the day, every day, and so it was more difficult to get them to admit to a change in cognitive function. So I'm unable to comment on marijuana smoking, but this is beyond the scope of this conference, but since you asked specifically about marijuana, in a separate study on pedestrian injuries, we found that persons who smoked marijuana were more likely to need hospitalization.
Thank you very much, Dr. Fletcher. Final question for you, Yelisu, because I'm getting my wrap-up note. I noted the presidential decree and the Department of Assistance for Victims and Families. So that's a decree. Has it been actualized as yet? No, that's for Yelisu.
Has it been actualized, the decree?
Has it been budgeted for? Is it in place right now, that department?
No, the department is in process. There is a space. It was furnished. It's going to be staffed soon. We're in the setup stages, but yes, it will begin soon. We just don't have a start date yet, but definitely this year.
Excellent. All right, thank you very much, panelists. Thank you all for your attention and participation. We're going to move into the next session now. Paula, thank you all very much.
We will be moving into the next session after a break, but just before, we have to say thank you. So we'd like to present you with some gifts, tokens of our appreciation, and they'll be presented by a member of the National Helmet Wearing Coalition. He was a panelist yesterday, told us stories of his days trying to impress ladies on motorcycle. Christopher Atkinson, come on up, Chris. We call him Chappie. Please, one by one. To the camera. Hold on. That's it, yes, because we're going to stay. We're going to have a group shot. And we ask all of you to stand together for one final group photo. While they do that, ladies and gentlemen, we will have a brief break. There are refreshments outside for you. You are invited to enjoy. We'll be back in for our next session and Aggie. That line that's on. Thank you, ladies and gentlemen, and thank you, Mr. Atkinson. You driving back down, or you staying with us? And so, ladies and gentlemen, it's time for us to restart our program. Welcome to those of you online who've joined us. And there are some persons in the room that joined us after the start. Welcome, welcome, welcome. Day 2 is proceeding very well so far, if I may say so. Are you in agreement? Thank you. So, we spoke yesterday about the relationship between the FIA and our endeavor across these 2 days. There were some folks that weren't here. So let me remind you that the FIA is the world governing body for motorsports with direct interest, clearly, in motorcycle safety. And the FIA Foundation is the charity arm. With us representing the FIA Foundation as programs director is Aggie Krasnolutska. I'm trying really hard to get the right pronunciation, but help me to welcome her. I know I can do that well as she addresses us this afternoon.
Yeah, thank you, Paula. Good morning or good afternoon. Good morning. Good morning, everybody. Good morning. Really nice to see you. Again today. We had fantastic day 1 and we are halfway through fantastic day 2. I have been invited to speak a little bit about the catalytic impact that creating helmet coalitions might have on changing the regulation and motorcycle safety around the world and the work that Foundation has been doing in this respect. I think my slides are not working. And I feel that a little bit of this was already said yesterday. Gonzalo was talking about Mexico Helmet Coalition. Sam was talking about, perfect, thank you, Kenya Coalition. So you already have gotten a little bit of the gist of what the coalitions are. And of course, we are hosted here by the Jamaica Coalition, so you are most familiar. But hopefully my presentation will synthesize the approach a little bit more and will bring up some new ideas and some new angles to this actually story of change, because that's what I'm going to talk about, how you make a change using the framework of coalition building. But I start from the beginning. And the beginning, it's about motorcycles, of course. They have been dominating transport systems for a few decades now. Their sales represents over $100 billion market, raising to at least $140 billion by 2032. I think we're all familiar with the fact that Asia Pacific has the highest number of motorcycles. It represents almost 2/3 of the sales, but Africa and Latin America are seeing also exponential growth. And why? It's because motorcycles, next slide. It's because motorcycles are cheap, they are easy to maintain, they are obvious choice for people who want independence but can't afford the car. Motorcycles provide also an important service. They either couriers or taxi drivers. They are useful, they are flexible, but they are also vulnerable. According to the Global Status Report, you've got a graph from the report here, motorbike riders now account for 30% of global road traffic fatalities. And this plays out in hospitals like this one here in Togo, which we visited with the journalists from the UK newspaper last year. Motorbikes account for nearly 70% casualties in Togo, and the results are just like here on this picture. It looks like a hospital in a war zone more than anything else. Motorbikes riders are often young men. They are often economically unstable on the fringes of the society. Politicians and communities sometimes demonize them as borderline criminals and don't really know how to engage with them. And this is the issue that does not necessarily seem to fit very neatly into safe system approach. It's seems a little bit too wide and a little bit too chaotic. And also the road safety community has not quite cracked the problem. We have very well evidenced solutions and we have best practice, but the real world application seems much more complicated and calls for the engagement of wider forums. And this is precisely why a few years ago at the foundation we decided to use the approach of coalition building in addressing issues of helmet safety. We thought that bringing together different sectors, sitting them around the table, making sure that they discuss the same problem and look for solution will enable collaboration, respect, and will remove the risk of duplications. Typically, the coalitions consist of public and private and civil society representatives, and they come from different backgrounds, different disciplines, different sectors, and represent different ages as well. And bringing them together opens doors to creating comprehensive solutions and securing multi-sectorial buy-in. And this is how our journey began in 2021. In collaboration with lead partners in each of these countries, we've established our coalitions. The first one was Kenya, followed by Mexico, Jamaica, Rwanda, Vietnam, and Thailand. And this is when the fun and lots of hard work began, of course. Each coalition has plenty to do, and there is a very specific terms of reference that they need to follow and very specific deliverables and policy steps. So as you can see on the slides, coalitions are tasked with the following objectives. They are to create long-term demand in country for affordable and certified helmets. They need to address issues of standards regulation, enforcement at level of the police, of course, and the street, but also entry points for the helmets. They work to improve awareness amongst the community and users, and they tackle issues of availability of counterfeit helmets. Coalitions also work to leverage additional funding. And what we're doing here today, and very nicely done and organized by Jamaica Coalition, they also aim to initiate the regional dialogue and best practice exchange. But where do you start with such an endeavor? So we said it, of course, today, and we said it yesterday. You really need to understand the scope and the scale of the problem, because beneath headline numbers, there is often little granular data available about the reality of what is really happening around the world. So the Kenyan coalition undertook a study of motorcycle deaths and injuries to get a sense of the health burden and the cost of it. The coalition in Mexico conducted situational analysis to identify barriers to access and use of certified helmets. Also here in Jamaica, the similar study has been done to understand the specifics of the users, the population, the demographics, and challenges they face to access safe helmets. And we really need more this kind of analysis to make the economic case for action for governments. The hard data can encourage implementation of the policies that we know are proven to change the situation and drive down the motorcycle casualties. The latest report from WHO shows us that there are many countries which don't meet recommended policy levels in this area. But what we also find on the ground is that where there is a standard in place, in reality, these are just lines of words on the paper. They are written down, but they are not enforced, they are ignored. Why? Because helmet safety is not a policy priority. What we see very often through our project is a lack of coordination and shared responsibility between agencies. This leads to gaps in regulation and safety awareness. And this is what we have been discussing here throughout these two days, how important it is to bring different agencies to collaborate and work together. But this can change, and we really have good examples of how things are moving and progressing thanks to this constant, ongoing, continued action and pushing and advocacy of the coalitions. In Kenya, the motorcycle helmet safety has become an explicit part of the National Road Safety Plan, which was launched last year by the President. A great example comes from Rwanda, where until recently there has been no standard at all. Last December, after months of intensive work, the Rwanda Standard Board has published standard which now complies with the UN 2205 and certification scheme. In Mexico, we have seen updates to state regulation to reflect need for a certified helmet, and now 25% of Mexico population is living in states that are enforcing the certified helmet use. The coalition has also secured the commitment from the private sector to remove non-certified helmets from circulation. And this is really a big win and very important steps to synthesize private sector so it aligns with country regulations. Of course, things are happening in Jamaica as well. The standard has been reviewed, and the framework that regulates the import of helmets to country has been prepared by main agencies. It's now awaiting for the approval after the public consultations. And what is really critical is that main agencies started to talk helmet, streamlining their work and their interagency collaboration. But requiring the standard is only just the start. Countries need to control helmet supply at the borders to eliminate entry of counterfeit helmets and to regulate domestic productions. Jamaican regulation is a very strong first step, but what is really needed is the testing capacity in country to expose substandard helmets. We're very proud to be citing this success in Rwanda. The very first helmet testing laboratory in Africa was installed and launched last year in December, and this, along with the standard, has been a joint effort of a number of agencies led by our partners from the coalition, and crucially with the strong leadership from the Rwanda government. The president of Rwanda has understood that his people are dying or sustaining lifelong injuries and gave his full backing to our work. And this is what we need to see around the world, in countries where we work, in countries where motorcycle safety is an important pressing issue. Because when officials understand why helmet standards are vital and have means to test, they will better understand the need for supply of affordable helmets. They can pressure helmet suppliers, encourage local production, and remove taxes and tariffs to make helmet pricing affordable. And that's critical, removing taxes and tariffs to make the product more affordable. This is a production plant in Vietnam that we funded, enabling partners from IAP Foundation to produce UN standard helmet for around $15 price bracket. And we need to see more factories like this across the world, because this will help to ensure that every rider can buy and can afford the helmet. Of course, the private sector needs to step up as well, and they have to play their role. All manufacturers should provide helmet as part of the motorcycle purchase. Governments should demand this, as recently has been stipulated by the government of Dominican Republic. Also, as a result of the advocacy work in Mexico, thanks to Mexican coalition, the private sector is now providing loans, enabling riders to buy certified helmets. Another interesting opportunity, another step to consider. Furthermore, courier and delivery firms should ensure their riders have a standardized helmet, and more companies should support training for taxis and ride-hail riders. And these are discussions that Helmet Coalition in Kenya and Rwanda are having with representatives of private sector and government to make it an official regulation. And once you have standards and law in place, it really enables more consistent and effective helmet enforcement and training. It doesn't always have to be hard enforcement. Building trust, for example, with motorcycle associations, as colleagues in Kenya are doing, is also very important. So I think it's clear that, and this is why we're having this two-day gathering here, just to stress the point that addressing issues around helmet safety is a long-term process and it's very complex. But we believe that the coalition building is a good framework for this, as it engages individuals, organizations, and governmental partners. Our most successful example of the coalition work comes from Vietnam, where over the 10-year period, estimated 15,000 lives and 3.5 billion US dollars were saved. But examples that I mentioned from Rwanda, from Kenya, from Jamaica, and from Mexico come from only last 4 years, and they are really a strong testimonial that the approach works and brings results. And finally, the coalitions that Foundation supports don't operate in isolation. They share learnings, they share knowledge and best practice from respective countries to ensure that we are catalyzing best practice for the global benefit. And of course, there is lots of work to do, a lot of riders and pillions to protect, but throughout the coalition, and I think also throughout this room today, we all agree that helmet is a barrier between life and death. And we hope to collaborate with as many as possible of you to bring this solution to every rider, because as a group, we are much stronger, of course. Thank you.
Thank you, Aggie, and thanks again to the FIA Foundation for being an integral part of this transformation that has begun to happen in Jamaica as we advocate, collaborate, and transform. So our 2 days culminate in this, our final panel, ladies and gentlemen. And this panel is looking for best practices and solutions. Now, it's going to seek to identify those practices in various areas: motorcycle driver training, licensing, and inclusion. It will highlight innovative approaches to improve safety outcomes and scale practical solutions across Latin America and the Caribbean territories. Our moderator is the Executive Director of the National Road Safety Council, and that is, of course, Jamaica's lead agency for road safety. It's a position she's held since 1996, and with over 35 years of experience in the social sector, she's led national efforts to reduce road traffic injuries and fatalities through a multi-sectoral approach under the council, which is chaired by our Prime Minister. She previously held senior roles at the Planning Institute of Jamaica and the Canadian Cooperation Office, managing international development projects and cooperation agreements. She has an MBA in finance from the University of the West Indies, and she has received international training in traffic safety management, road safety audits, and driver behavior and risk assessment. Please help me welcome Paula Fletcher to handle our next panel.
Afternoon. Is it afternoon yet? Yes, it is. Good afternoon, everyone. How are we doing? I think we're going through quite nicely, and even though this is the last panel discussion, it's not the least by any means. I just want to start off by congratulating our partner, the Jamaica National Foundation, for pulling this together. I can relate to it, when I compare it with other fora such as this, that I think they've covered all the bases and that the information has been rich and the sharing has been rich. So let me go ahead then and call up the panel. Marlon Cotter Fletcher. We haven't established yet if there is any relationship. We share our surname. And the next one, Dave Cliff, who has been able to fill in at very short notice and who will fly out with over 30 years of riding, racing, and stunt riding experience across Jamaica, Canada, and the USA, and the Caribbean. He's a certified motorcycle instructor, and he's deeply committed to rider safety and education. Marlon serves as president of the Jamaica Motorcyclists Association and is the lead for community engagement for the National Helmet Wearing Coalition, where he drives the initiatives to promote helmet use and responsible riding. Beyond motorcycling, he actively mentors youth and supports community outreach programs, making a lasting impact both on and off the road. So this is a good fit for you, Marlon. Okay, and then we go to Dave Cliff. This one is on my phone. So Dave Cliff is the Chief Executive Officer, Global Road Safety Partnership. Oh, somebody said something? Oh, okay. Chief Executive Officer, Global Road Safety Partnership. He's a seasoned leader in road safety and policing with over 3 decades of experience dedicated to making roads safer. Since April 2017, Dave has served as CEO of the Global Road Safety Partnership, where he leads efforts to reduce road trauma in low and middle income countries around the world. Dave's passion for road safety was shaped during his 34-year policing career in New Zealand, rising to the rank of assistant commissioner. He oversaw road policing nationally and managed all policing operations across New Zealand's South Island. He contributed his expertise as a member of New Zealand's National Road Safety Committee and as part of the New Zealand Police Executive, driving initiatives that have saved lives and improved community safety. And then next we have Frank Fortier. He is the president of FIA Mobility Region 3, covering North America and the Caribbean. Currently, he's serving his 2nd term. He previously spent 25 years as Chief Operating Officer of the Canadian Automobile Association, overseeing corporate affairs, finance, human resources, and automotive and insurance operations. Before CAA, Frank held senior management positions in the major insurance company, leading a team of 300 serving corporate clients in employee benefits and pensions. He's a graduate of Carleton University and resides in Ottawa, Canada. Then on to our Colonel Price. Okay, Colonel Daniel Price is the Director General of the Island Traffic Authority in Jamaica, bringing extensive expertise in transport oversight and public safety. He's a former senior officer in the Jamaica Defense Force. He held key roles in operations, logistics, and national security. At the ITA, he has led modernization efforts in road safety infrastructure, vehicle inspections, traffic law enforcement, advancing digital transformation, and strengthening partnerships across sectors. He holds an MBA from the University of the West Indies and has completed advanced military training locally and internationally. Welcome again, gentlemen. So over these, well, this is the 2nd day. I concluded a couple of things, and one is that road safety work is really a movement. I don't know if I've ever heard it expressed like that. I don't say I'm original, but it's really a movement which all the players, that's all of us here, are committed to playing a part to attain safety on our roads over time, as it certainly does not happen overnight. I further concluded, and this concept is not really new, that it certainly takes sharing different perspectives, and Aggie just said it, on common problems with a view to seeing what can be adapted to the specific problem we seek to resolve in our respective countries. Letting ideals pool together and contend in a way to help us to make effective choices to foster development. So we have been tasked with looking at the matter of creating safer motorcycle drivers and what are the considerations for learning, licensing, and inclusion. So as a panel, we'll seek to identify best practices in motorcycle driver training, licensing, and inclusion. As I just said, we will highlight innovative approaches to improve safety outcomes and scale practical solutions across Latin America and the Caribbean. So we're going to start with you first, Frank, so that you, even though I hear you say you're staying, but anyway, we'll start. No, sorry, not with you, Frank. Sorry, Dave. I was asked to start with Dave. Right, so, and I have to go back to the phone because I just got your information. So talk to us, Dave, about innovative ways for the education for safer motorcycling. Provide insights on how countries like Jamaica, can align training and licensing frameworks. Also share with us some successful grassroots education or certification programs that can be tailored to vulnerable or underserved riders. Also look at the matter of exploring opportunities for cross-regional collaboration with the Caribbean. Over to you, Dave.
Yeah, sorry, I was going to talk about legislation related to best practice, which I missed yesterday. So hopefully, if that's okay, shall I talk about
So it's
those?
different from what I just said?
Exactly.
I just said what I was told to say. So there's a change? Well, you go ahead. You go right ahead.
Now, can we bring up the presentation? Is the challenge? I'll try this. Great, here we go. So just as a very quick explanation, I was meant to be part of a panel yesterday, couldn't make it because of the flight issue, so I'm just going to run through this. So it's looking at legal frameworks that can make motorcycle helmet wearing occur at a higher level. So just to give a context, and Aggie made a really important point, that when you pass legislation, it is just writing on a piece of paper until it's enforced, until people know about it. And this was very well explained through an editorial that appeared in The Lancet, which many of you will be aware of, a prestigious medical journal. And it was related to riots that were occurring in Bangladesh. So the story had been that 2 students had been killed by a speeding bus, and this prompted national riots where students from right around the country went out and they protested, they stopped traffic, and they started enforcing the laws themselves. And they said something must be done about it. And so the editor of The Lancet said this, essentially said that campaigns focused on improving road safety are meaningless unless there is good law and it's enforced. And so often we see around the world that there are campaigns asking people to drive more carefully or drive safely. And the government often do this and support these programs to give the impression that they're taking the issue seriously. But without the enforcement sitting in behind the law, it simply won't change behaviour. And we have multiple examples that occur from around the world that show that the law of itself doesn't change behaviour. It's that consistent enforcement of it by well-trained police that can change behaviour. So first point. So if we go to universal helmet laws, this is basic. You'll all understand this, that firstly we want laws that require both the rider and passengers to wear approved helmets that meet an accepted standard, that they're correctly fastened, which is clearly critical. We heard about the importance of the right sizing as well. And then we need deterrent level penalties. So what we mean by that are penalties that actually create an incentive for the rider to comply with the law. If the penalties are too low or regarded as ineffective, they won't change behaviour. So while fines have an effect, we know that systems that result in demerit points or disqualification from driving or impoundment, these sort of combined tiered penalties are the sorts of initiatives that can really change behaviour. But once a rider is issued a penalty, it only becomes effective if it's followed up. So if a rider can avoid paying the fine or the police don't follow up on demerit points or disqualification, so effectively they don't have any real impact, then it doesn't matter how much enforcement police are doing, it simply won't change behaviour. So the system of the law, deterrent level penalties, and then their follow-up have to all be in unison to create that behaviour change. Now, we also know from working with police agencies right around the world that many face the problem of motorcyclists who choose not to stop. They're small, they're nimble, and chasing motorcyclists is inherently dangerous. And as a former police officer, we all understand the risks that police, in an effort to stop the rider, don't want to cause a death or a serious injury as a result of trying to stop them. So one way of trying to achieve this is to ensure that supporting legislation, so things like ensuring that registration plates are clearly visible and that there are significant penalties when a registration plate is obscured or not attached. The fact that there are very robust systems and accurate systems that show who the owner of the vehicle is, the address, date of birth, and all that registration data is in place. That the penalties for failing to stop for police are significant, and there's laws in place that require the owner of the vehicle to supply the details of the rider. So these are the sort of support systems that need to be in place. So if a vehicle doesn't stop, police can record the registration number through photography, video, or an officer actually seeing it. And then the law supports the police following up and finding out who the rider was. So these are the sorts of tiered systems required to make the system work well. And we also know the importance of standards. I won't need to go into that. We have Dr. Terry Smith with us, the helmet guru, who can talk with great authority on the importance of a standard testing systems that ensure the helmets meet all the safety requirements that are needed to protect the human skull in the event of a collision. So laws are not sufficient on their own. They have to be rigorously enforced. And the standards of the helmets coming into the country and approved for use are essential. We all know that it's important to have a helmet, but not all helmets are created equal. So if it's my family or if it's you, you'll want to have the best protection that you can get. You want to make sure that if you have a crash, that your head is protected as much as it can be. Now, on the right-hand side there, the high visibility helmet has two benefits. High visibility helmets mean that a rider is far more likely to be seen. Just the simple act of having a high visibility helmet, so fluorescent or white, reduces the crash risk by about 20%. So if we just had people wearing white or fluorescent helmets, we would immediately have that benefit. So in some countries, they're thinking about legislating the colour of the helmet. Very basic, but really important. And the full face protection protects not only the head, but the face. And again, we know from the science, and again, Terry can talk to this, around 30%, Terry, is it, of the injuries that occur to a motorcyclist's head will occur to the facial and to the face. So if a rider doesn't have that full face protection, they're still going to need plastic surgery and all of those medical interventions because of preventable injury that they will still receive if they're wearing an open-faced helmet. So you've got this graduated least protection on the left through to the highest protection on the right, which I think we need to think through in terms of those public messages. So what do we mean by consistent policing? So in many parts of the world, you'll see a campaign, a short time-framed approach where there's a rigorous enforcement and then it reduces. But the enforcement needs to be sustained over time. The most effective improvements in wearing rates occur when police are consistently enforcing the law day in, day out, week after week, month after month, relentlessly. So during a period of campaign, the enforcement could increase, but it never stops. It just continues at that baseline level. Hugely important. There needs to be enough of it to change behaviour. And if we think about the medical analogy of dosage, if we were trying to inoculate the room, we can't work out who exactly is going to contract the disease. We can't just inoculate one table. We've got to inoculate everybody. In the same way with enforcement, we can't tell which riders are going to have collisions, so we have to enforce against the entire population to ensure we inoculate the whole population from road trauma and the head injuries that result from not wearing a helmet. But if we don't do enough enforcement, it simply won't change behaviour. If riders don't become the subject of that enforcement, they'll continue not to wear helmets. So the typical formula is if we see the level of enforcement double from whatever level it's at, we'll see that behaviour change start to occur. And there needs to be a continuing doubling over the course of years to reach that threshold of deterrence that gets wearing rates up to the desired level of 98 or 99%, as we see in countries that have a sustained approach to enforcement. We know that enforcement on its own is effective, but it's enormously amplified when there is the public education supporting the enforcement. So we need both. We do know from the science that education on its own hasn't proven to change behaviour, but when you combine both, the enforcement and the education supporting each other, that's when we get the real change in rider behaviour, which really does make a difference. And we also need very well-trained police. It's not just about going out and enforcing the law, it's educating police officers on why. The impacts of trauma on the brain, what a helmet standard is, what to look for when you're inspecting a helmet to understand if it's a toy helmet or one that offers no protection, so they can talk to riders on the roadside. And of course, we know that if police adopt what we call procedurally just approach, they interact with the public in a positive way, it's educative as well as enforcing, that they can achieve much higher rates of compliance when they adopt a very professional approach in dealing with members of the public. And so when we design campaigns, if they're just And so when we design campaigns, if they're just focused on the trauma consequence, most riders will dismiss it because it's not relevant to them. They're a good rider, it won't happen to me. But if the enforcement can be turned up so that riders see it likely that they'll be stopped and penalised over time, and as long as that belief is supported by seeing and experiencing enforcement, they will change behaviour. So we need to build our public awareness programs that focus on realistic messages. That's it from me. Thank you very much.
Okay, thank you so much. We'll come back to you with a question, but I must now go to Frank Fotia. It was you, Frank, who has to leave. So please jump right in. And we're asking you to share how FIA supports training, licensing, and helmet safety across Region 3, and highlight collaborative pilot projects or training frameworks. And also, indicate some of the challenges and innovations in inclusivity, especially with rural riders, which is our focus here in Jamaica, and as well the informal sectors.
Thank you, Paula. Thank you to the JN Foundation, the FIA Foundation, the JAA, and my Region 3 colleagues who are sitting here. As president of FIA Region 3, I represent mobility clubs in North America and the Caribbean, and advocating for road safety is one of the key pillars and the raison d'etre of our clubs. I'm going to present today just on two different subjects. One is the role of the FIA. How does FIA help in the project to improve road safety, and specifically helmet wearing in the context that we're in today? And secondly, I just want to give a brief example as to what is going on in my country, Canada, and to show what results can be achieved when there is enforcement, when there is societal acceptance of safety and other initiatives. So first of all, how does the FIA help? Well, one method is financial assistance. We know about the great work of the FIA Foundation, which was seeded by the FIA more than 20 years ago and is a great collaborator with FIA clubs. But within the FIA itself, we also have programs that contribute to safety initiatives. One of them is the FIA Road Safety Grants. And in addition to the foundation, the FIA writ large offers grants to all clubs for road safety initiatives once they have been vetted and approved. And of course, helmet wearing is certainly one of those key requirements. At the regional level, we have a fund to invest in advocacy programs that all our clubs have to do is apply. And if it's merit and we can afford it, we'll certainly fund the opportunity. So again, any initiative related to helmet safety would certainly qualify. The JAA and clubs in Mexico, Belize, and the Dominican Republic have benefited from these funds in the past. The other method where FIA helps, and that is in information sharing, best practice sharing, and collaboration. This time, we have the Road Safety Index, which again contributes to safety. It is, of course, about wearing helmets and about having good safety behavior, but you also want to have great roads. And the Road Safety Index is a method for the FIA to assess the safety conditions of various road networks. There's a new initiative called Safe Mobility for All and for Life, where clubs, our member clubs, are partnering with local government officials to partner with the stakeholders on various safety initiatives. And again, this is where the helmet wearing coalition can certainly benefit from that. We've got 2 pilot clubs, one in Mexico and one in the Dominican Republic, that are taking advantage of this program. In addition, we have school safety zones for clubs and organizations globally, where for $1 million, around $1 million, assuming that the local government donates the land. He has developed a template for a helmet factory that could be operational in less than 1 year. And this would include a certification element to it. So this is something that has really great global resonance, and I would encourage folks in this room to get their hands on this template, and I can certainly make it available to the group here, and deal with your local governments, and if they can donate the land, you can get a local production up fairly quickly. So with that, I'm just going to shift to the situation in Canada. And Canada is at a very good place as far as motorcycle safety is concerned. Now, one great contributor to the safety is that you can't drive a motorcycle at least 5 months of the year. But over time, the country has developed very strong licensing practices, strong training programs, very strict safety laws and standards, and strong public awareness campaigns where my club, the CAA, has played a very active role. Licensing to ride a motorcycle is graduated, so you can't just write a test and be on the road right away. You have to take a written test, you have to have your vision screened, you have to take several road tests, and you cannot ride on highways right from the beginning. You have to slowly build your experience level, slowly build your competency level until you can ride with an unrestricted license. And of course, there are great insurance incentives for taking safety courses, and the more safety programs you take, the lower your insurance rates will be. In Canada, about 15 to 20% of new motorcycle riders are women. And so providing inclusive training to help specifically train women to be competent bike riders has been introduced. Standards, Canada has one of the highest helmet safety standards. Enforcement is incredibly strong. We rarely see counterfeit helmets on the street, and this has really contributed to very widespread compliance, and you rarely see a motorcycle rider on the road without a helmet. I think there's so much compliance that I think if a motorist were to see one, he would call the police and say, hey, there's a motorcycle rider on the highway without a helmet. So it's a lot of group dynamics around supporting this. And with 200 deaths a year and with a population of about 40 million people, I was listening yesterday to one of the presentations on Jamaica, and Jamaica is about 1/10 the population of Canada, yet we'll have more than double the motorcycle fatalities if the current trends continue. And just before I leave Canada, I just want to make a brief reference to Mexico, and I think Aggie referred to Mexico earlier. They have had very strong campaigns on helmet wearing. One of our member clubs, the ANA in Mexico, and OMDI have provided free helmets in the Mexico City area to those that qualify. So I think the message is that solutions can be reached. It does take time, it does take societal pressure, and it does take all of the interested parties working together. Thank you.
Thank you so much, Frank. Just one quick question. Based on what you have heard, what do you think are two key things that you think Jamaica should prioritize going forward?
I think certainly compliance with the laws is, and then encouraging helmet wearing at a very young level. Getting an affordable helmet in people's hands, like as Aggie described. In Vietnam, they've got helmets that can, for about $15 US. And that's pretty affordable for most people.
Right, okay, thank you for that. And when you go back and you meet at the higher level with your directors and your board, could you please convey our appreciation, because you have funded several initiatives in Jamaica, including the 1,000 helmets for the National Road Safety Council training project. So we do appreciate your help and support, and we will release you now. Thank you so much for participating, or are you going to stay? We'll release you because we understand that you're to be released. Yes, thank you very much, and safe flight home. Okay, so we're moving on now, and we're going to you, my namesake, Marlon. You have your... Right, so share with us your reflections on personal or observed experiences with unsafe motorcycle practices. You're out there on the roads in Jamaica, so we know you're an expert at speaking to this matter. Also, give us some insights on gaps in training, access, language barriers, and misinformation. Emphasize, of course, the trust building and the importance of visible role models in communities. Marlon.
All right, thank you for... All right, good afternoon, ladies and gentlemen. Now, I've been riding motorcycles from...
Can you hear him?
Better now? Thank you, yeah. So I've been riding motorcycles from a tender age, and it is safe to say that I have dabbled in every era or every section of motorcycles in Jamaica, from racing to motorcycle stunting, and I have been a delivery rider, which is the class of motorcyclists that we need to reach. I've been a delivery rider since 1995, right? I now hire delivery riders all across the corporate space that you see in Jamaica. And I also ride on weekends. So it is safe to say I ride a motorcycle seven days out of for the week, right? Now, slide please. Okay, good. So, enhancing motorcycle safety in Jamaica, right, through experiences, language barriers, and community trust. Now, I want to start by sharing a personal incident, an incident that I call the Devon House incident. Now, who are familiar with New Kingston roads, I was riding my motorcycle on Trafalgar Road with an intention to turn down to go to Halfway Tree. So I stopped at the stoplight at YMCA. Here comes this rider, boom, 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 boom. Turn left, break the red light, head down the road. Now, ladies and gentlemen, why is this alarming? It is not. The driver beside me rolled down his window and he said to me, "You're not a rider, man. See rider there." Right? Now, we're in a culture in Jamaica where people celebrate wrongs, and they celebrate it so much that when you do the correct thing, you actually look stupid. And that is how I felt sitting at the red light. It's like I'm not supposed to do it. These are patterns that we see regularly on our nation's roads. Helmetless riding, especially in the rural areas, overloading of bikes with passengers and goods, lack of signaling, weaving through traffic, speeding, and lack of judgment. Now, ladies and gentlemen, lack of judgment is an important factor in riding a motorcycle, right? Because when you have a collision car to car, the two drivers come out and they discuss it, whether they discuss it angrily or calmly, they discuss it. When a motorcycle have a collision with a car, 9 out of 10 times, the rider is on his way to the hospital. Am I correct? Good. Now, if this video could play, can it play? No? If it's not, I'll move along. No? All right. Here's a common example of unsafe motorcycle practice. In my opinion, no one there is wearing a helmet. None. All right? Now, this is his 2 children that he would have loved dearly. And he went to pick them up on a motorcycle because obviously that's all he can afford. Right? But neither of his kids are wearing a helmet. he's not wearing a helmet too, in my opinion, because the helmet is not securely fastened to his head, right? Common experience that I see on the road where you would pick up your child, it is not correct, but at least it's a step in the right direction or an attempt where you would pick up your child on the road and you don't have a helmet for the child. It's your child and you love your child. You would take off your helmet, though it's way bigger than the child's head, you would put it on the child. Though it's not correct, it's still an attempt. Riding is seen by some as freedom, rebellion, or necessity. I want to stick on those three words for a minute. Ladies and gentlemen, there are three classes of motorcyclists in Jamaica. There's what we call the weekend warrior. Myself is one of them, where you would have had a motorcycle, but you also have a job, and your motorcycle would have been parked, and on the weekend you would go for a ride just to clear your head from the stresses of the week, or maybe you want to get away from the wife, I don't know, but you would just go for a ride, right? Those are the freedom riders, right? The percentage of fatalities among that group is very, very minimal, probably 1%, okay? Then the next word I want to talk about is necessity. These are the cohort of riders that use their motorcycles for their job, right? They are the delivery drivers, they are the weed whacker man, the gardener, etc., who have a motorcycle and ride their motorcycle for work, at work, and for work. All right? We're seeing a great compliance from those set, especially in Kingston and St. Andrew. Then we have the rebellious group, okay? What we often see from this group is just recklessness, downright desperation and ignorance. They don't wear helmets. Sometimes they don't even wear clothes. They wear shorts and slippers, and they operate the motorcycle recklessly. Now, ladies and gentlemen, if we target that group, we will make a significant impact on our nation's roads, because that is a group that needs targeting. Access to training. Many riders never receive formal training or licensing. Why? Cost and time are major obstacles, and several of the people that are affected by cost and time are like the motorcycle taxis and the delivery service drivers. Few community-based initiatives and community-based training program, because they are not going to training. A lot of times we have to bring the training to them because them can't bother. All right? Lack of enforcement. I always say this: if you do something and get away with it, you're going to continue to do it. And that is what we see in Jamaica, where they are not being targeted. They are not, the laws that are currently in place are not enforced, and they just have a free-for-all because they keep getting away with it. So a lack of enforcement is really serious. Another thing, manual and the training materials are in formal English, and some riders struggle with comprehension, especially from the low literacy background. And this is why I believe that practical and visual training are often more effective than written tests. I am a trained motorcycle instructor, and I have never trained a common Joe that wants to ride a motorcycle. It is always people from the upper echelons of society, the popular people, the social media, that wants to ride a bike or have it on a bucket list, so they want to learn to ride a bike as part of their life. And they never become riders. They just learn to ride it to say, I did it. Misinformation. This is a major factor that is affecting us. May I ride for years, so me good. That's something that we hear all the time. What you find here is that overconfidence replaces skill. Me I ride for years, I'm still not good. I'm still not the best. All right? Because with a motorcycle, operating a motorcycle, there is always something to learn. There's always a near miss or a near accident to learn from to correct the next time you go on a ride. One of the common myths we see is that helmet reduces visibility and hearing. I have to laugh at that, because if I attempt to ride a motorcycle without a helmet, my hearing and my visibility is far decreased based on the wind, the dust, the noise, the trucks, and all of the hazards that are around us. Riding a motorcycle in a helmet is like driving a car with your windows up. All right? It's more visible, more hearing, better control, everything. Peer-led learning equals bad habits passed down. Okay? My brother ride for years, and I'm a bad rider, so I'm a bad rider too. He would have never received any formal training, but because he's riding and he's from a family of riders, he believed that he's a rider. All right? When information doesn't meet people where they are, a lot of misinformation takes place. Ladies and gentlemen, why trust matters? Riders often feel targeted by the police and are not supported. All right? Safety campaigns can sound like lectures and not conversation. I personally think that we need to stop talking to each other and start talking to them. All right? We can reach them in their personal space. We are in a social media era where everyone has TikTok, everyone has Instagram, and everyone has a phone buried in front of their faces. If we can't reach all of them physically, we can reach them virtually. What builds trust? Local respected riders demonstrating helmet use and safe riding. Community programs led by former riders, mechanics, delivery bikers, and police riders. Police enforcement that educates and not humiliates. All right? Sometimes when you stop a motorcyclist on the road, you can actually talk to him and encourage him rather than humiliate him. And we find that that happens a lot on our roads. All right? Drivers, this is a very big one. You have a big part to play too. Okay? Let me see the hands of anyone in the audience that has almost hit a motorcyclist from his bike from the year start. There you go. Right? We have to look out for them. We have to save them from themselves. We have to save them from themselves. And as a driver, when learning to drive, it is in your psyche to look out for oncoming cars. It is never in your psyche to look out for motorcyclists. Motorcycle is a very slender thing and it moves very fast. So let's say you're on a minor road coming onto a major road. As a driver, you're looking out for other cars. But it's not embedded in your brain that a motorcycle might be coming. And this is one of the reasons why the most modern motorcycles are permanently affixed with headlights now. You cannot turn off the lights. And that's the reason that the manufacturer started making the motorcycles with the headlights permanently on. Successful examples, Ride Smart programs in schools. I must commend the National Helmet Wearing Coalition. They have been going to schools across the island teaching about helmet safety, and I must commend them for that. Youth-led biker safety clubs, police collaborating with biker clubs, and not just crackdown. Let me read that again. Police collaborating with biker clubs and not just crackdown. When a young rider sees someone in his own community doing the right thing, ladies and gentlemen, it clicks differently. In closing, to move the needle on motorcycle safety in Jamaica, we need more than laws. We need an understanding, we need access, and a trust. Riders aren't the enemy, ladies and gentlemen. They are the key. Let's speak their language, go where they go, ride where they ride, and raise them up as role models. Thank you.
Thank you so much, Marlon. I'm going to get back to you because you're talking my language. So, Colonel Price, over to you now. We want to look at what is the current licensing methodology that you're using. What are the gaps, especially for motorcyclists? What are the recent or proposed reforms? Example, digital licensing, mandatory testing. And share with us some insights on driver testing, recertification, and monitoring. So it's heavy on licensing and certification for you.
Thank you very much, Madam Chair, colleagues, members of the audience, thank you so much for inviting not just me, but for inviting the Island Traffic Authority to be a part of this very important initiative. So I'll be talking about creating safer motorcycle drivers. The Island Traffic Authority, the ITA, as you know it, is a statutory body of the Ministry of Science, Energy, Telecommunications, and Transport, a mouthful, responsible for administering the provisions of the Road Traffic Act. And in those functions, we have responsibility for road safety, driver management, vehicle management, and traffic management, which at the moment is a delegated function. So I give you some statistics. So for up to June 19th, 2025, we have had 49 fatalities, motorcyclist fatalities. Also, we had 7 pillion riders, and the motorcyclists represent 28% of the total fatalities to date, and pillions 4%. You compare that to 2024, and you would have seen a reduction that is taking place in 2025. In terms of raw numbers, you see 49 in 25 versus 64 in 2024. And you see 7 in terms of billion in 2025 and 9 versus 9 in 2024. More statistics. So we're looking now at the motorcyclist-related fatalities involving non-use of helmet. Year over year, up to June 19, 2025, we would have seen that of the 49 fatalities in 2025, 40 of the 49 were not wearing their helmets. And of the 7 pillions fatalities, 6 of them were not wearing helmets. Now you see the importance of us pushing the wearing of helmets. And similarly, you would see in 2024, of the 64 fatalities, motorcyclist fatalities, 57 of those were not wearing helmet. And sad to say, last year, none of the pillions who died were wearing helmets in 2024. Again, there seemed to be a similarity. The younger men are losing their lives on motorcycles. So the 15 to 34 age group, which represents 63%, that is what we're seeing in terms of fatalities, motorcyclist fatalities. Again, more statistics. The actual parishes that we're seeing the greatest incidence of motorcycle fatalities Westmoreland, St. Andrew, Hanover, and St. James are the 4 leading parishes. And there was a similar situation in 2024, as you can see. So let's look now at the driver management. Pursuant to the Road Traffic Act of 2018 and attendant regulation, a learner should have a licensed motorcyclist traveling 6 meters behind him as the learner motorcyclist traverses the road. Can anybody from Jamaica tell me when was the last time we saw that? Right. So this is now in the new Road Traffic Act, and it will be enforced. So we have 3 categories of or classes of license: Class A, Class B, and Class C. Class A strictly relates to motorcycle. Class B, driver's license for private purposes, and the Class C for commercial and public passenger purposes. So the testing for motorcycle driver, and as I said, this is done by the Island Traffic Authority at the 15 service hubs. And if you notice, I didn't use the word depot anymore because we're moving away from that. It is service hubs. And so the prospective candidate should demonstrate his ability to read and write in English. He or she is also required to demonstrate knowledge of the road code, to start the motorcycle on a gradient, complete an obstacle course, and return to start position without losing his balance or her balance, and complete a yard test pursuant to Regulation 156 3A of the Road Traffic Regulations of 2022. Now, we also have a responsibility to inspect and declare a motorcycle roadworthy. Unfit motorcycles lead to crashes too. So the ITA is responsible for conducting physical inspections of the motorcycle to ensure that they meet the required road safety and operational standard, and therefore we would issue certificates of fitness to that motorcyclist. What does the ITA check for? In broad terms, we check for the lights, the horn, the exhaust system, and the tires, the quality of the tires. We did some motorcycle helmet assessment, and we did so in 2022. And the aim of this study was to determine the proportion of motorcyclists who wore helmets versus, and also to determine the proportion of pillion riders who wore helmets. We targeted the hotspot parishes across the island that included Hanover, Westmoreland, St. Elizabeth, St. Catherine, and St. Andrew. And of the 399 cyclists that were observed, 296 motorcyclists, or 74%, were observed not wearing helmet, while 103 motorcyclists, or 26%, were observed wearing a helmet. We need to ramp up that figure. In terms of the pillion, 108 pillions were observed. 107, or 99%, were observed not to be wearing a helmet, while a measly 1% was observed to be wearing helmet. Issues that we find with motorcyclists, I think my colleague and friend enunciated that to some extent. We see non-compliance, not wearing the helmet, for reasons that our friend, my previous speaker, spoke about. Illegal driving, no learner permit or driver's license. And if there's no learner permit, you can also bet that there's no insurance for the motorcycle. Disregard for road rules and the laws. I am sure there is no Jamaican here in this room who would not have observed the illegal wheelie taking place on the main road. That is even with the delivery guys, sometimes I wonder if when they take the food, you get a huge bowl of tossed salad. So the truth is, yes, we are seeing this level of indiscipline on the road. Overloading, that was clearly shown straight across the presentation. High injury and fatality. I can't talk like Dr. Fletcher can, but this is so. Lack of protective gear. You preach until you're blue. They still come out on a Sunday evening with their slippers and their shorts, and they're riding. And sometimes those are the persons that are wheeling on the road. I just spoke about the wheelie. Here we come. You see that almost every day. The informal economy, the use of bike as taxis, and you see the peer influence. I mean, I was very, very impressed by the previous speaker and his experience in it. He has brought out things that some of us would not have considered, and we certainly will take that into consideration. And Dante is over there taking notes. That's my corporate communication manager with respect to getting to those persons. I like what you say about talking their language and having the conversation with them. Some ongoing initiatives. We have a learner driver education program in educational institution, getting them from there in schools and in other educational institutions to start changing the mindset about the use of the road, especially for motorcyclists. We have community interventions in hotspot parishes. Sometimes I honestly don't see my communication and safety, road safety team, because they are out there in the community. I know that we need to do more, and we are so committed to do more, because this is a problem that we need to solve. We've had excellent working relationship and partnership with the National Road Safety Council in the motorcycle training and outreach. Can't remember this gentleman's name, but yes, we do those community. Marlon. I should have known that he's a Fletcher. Yes, right. We have partnerships with HEART, NSTA. There was a program that was launched, I think, last year, the LIFT program, and we partner with HEART in bringing the message for safety on the road, the use of helmets and all of that, to that program. Certified helmet distribution, that is something that we do, and sometimes almost on a daily basis. Sometimes persons, I drive on the road and I see a man riding without helmet and he stops at the stoplight, I am going to engage him. Why aren't you wearing a helmet? Is it that you don't have a helmet? No, boy, boss, me not have any helmet. And I say, follow me. And on occasions, they have. And they come to our corporate office, and we issue them a helmet. You go to certain locations, like when you go to the tax offices, you have a lot of bikers there that's doing the delivery and messenger work. Some of them don't have helmets. We have gone there, we have invited them, and they have come and get the helmets. Road spot checks with the constabulary force. I think it was Frank who spoke about the making it an offense for bikers not to comply to a constable who stops him, make that an offense. And I think that's something that we need to also look into. So, picture paints 1,000 words. This is one of the, a picture of one of the community intervention, and I'm sure Paula can fully identify. I think that's Paula there, right in the center. In the yellow. Right, yes. In the yellow and black. So there is the collaboration taking place to take the message to the motorcyclist. This is another one. I think this is road safety, and yes, I can see Dr. Campbell and Mr. Evans there, yes. Again, sending the message out, and you see the heart sign right in the background. That's what we're talking about. And these are some of the handover of helmets in 2025. This is one of the senior inspector of motor vehicles. I think this is in Lucy, where we're having this presentation. And you remember, this is the man that I saw right at the intersection of Holborn Road and Trafalgar Road, or Waterloo, Trafalgar. And I asked him, and he followed me. And this was the presentation that we gave. He was very thrilled about getting his helmet. And this is the Director of Road Safety doing a similar presentation. This particular gentleman was one of the messengers from tax office that was accosted and turned up and got his helmet. And it was no coincidence he got a red helmet for his red shirt. And this is another one. So let us continue to inspire change in the road safety and the transport sector. Thank you so very much.
Thank you so much, Colonel. So I have a couple of questions, and I'm going to start with you, Colonel. There's a burning issue I have. You've heard me express it, even around the table with the Prime Minister, who is the chairman of the National Road Safety Council. So I'm an individual, okay, a male, because it's mostly males that ride motorcycles. And my level of literacy is not such that I can pass your road code test. In some countries, you don't have to learn to read to be able to pass a test. We heard that Dave Cliff, he said enforcement is key. Now, normally to enforce, you need your driver's license because it's against that you earn points and you are issued a ticket, which is why most of the time the policeman seizes the bike because there's no identification. The driver doesn't have a license. So he'll take the vehicle, and the whole of the yard of the police station is full with motorcycles packed one on top of the other. I have to speak for the voiceless because my position, as you know, is to find a way to teach them the rules of the road in such a way that they can express the knowledge of how to use the road. We're signatories to the Vienna Convention for years now, which is we can use signs and symbols. So what are you going to do with that core of people? Because they're not going to learn to read anytime now. What are we going to do to be able to move them along that path, that they can have that little strip of any time we can improve the system, make changes, that they get that little thing, you're going to see a difference because you would have spoken to the person. And you're saying to them, no, you're legal, you're legit. What you're going to do about that?
Right, thank you. I think one of the things that we are looking at is how you can test the person by asking the person and the person answer you. They might not be able to read. They often know the different signs and symbols. So we're exploring the possibility of having a test that they can answer you rather than being able to write it. So that's something that we're looking at.
That is 3/4 of the problem solved right there. Could you please give a hand for that answer? I've been dying to get that answer. Marlon, are you in agreement with me? Right. So, you know, the law has to be changed, and yes, it takes a long time to do that. So, Colonel, this is on the agenda now, you know.
Right.
That I'm going to be asking of the ITA, where are you? What's the status? Because you know how we are.
Thank you. Keep my hand to the fire.
I will. I certainly will, because I think that is the day we turn the corner. Marlon, the helmets. Oh, yes, use that one. The helmets, one of the responses we got. And meanwhile, could you cue the video that I had asked for, please? The helmets, the response that we got, particularly the helmets we got from FIA, they're too plain and don't look good. You know, is that a factor you think in compliance, where the helmet should look a little jazzy, have a little color on it?
Yeah. What I find is that, in my opinion, helmet is like a sneakers, right? Now, the flashier the helmet, the nicer the helmet, it's the more they will be encouraged to wear it. Let me also hasten to say that the best helmet is an approved helmet.
Oh, yes.
All right? And the same testing that the flashy helmet goes through, it's the same testing that the simple helmet goes through, and they all meet the same safety standards. Now, when you talk about helmets in Jamaica, no one likes the half helmet or the quarter helmets. They like full face helmets. And the flashier, the nicer the helmet is the more they will be encouraged to wear the helmet, especially if it matches their motorcycle
Yes.
in terms of color.
Okay. So could we also take that one forward? I don't know if there's anybody here from the Ministry of Security, because the last purchase the ministry made, we were not even privy to what they were buying. So could we be cognizant of that, that they look, we have to meet people, you said it, where they are. There are approved helmets that meet the standards, that have a little look to them that they might want to wear, you know? So the next question is for you, Dave Cliff. Enforcement, and we're going to wrap up shortly. Enforcement, that's a big problem. the motorcyclists will ride off. Even if they slow down, they'll ride off. I know of at least 2 policemen who have lost their life, amputation of the foot, bled to death. They couldn't get him to the hospital quickly enough. And the police are told not to endanger their lives. What do you think the police could do to, and I know sometimes what they do, they will go, because they know them, you know, if it's a community, they'll know them, so they'll go to the bar and hold on to them then, or the community wherever they gather. Because a lot of our bikers exist in community. And in fact, they actually have biker gangs where they might not necessarily be doing crime, but they have rites of passage. The no headlight crew, so you're expected to do an initiation to ride across a road with no headlight and that sort of thing. What can the police do, you think, to ramp up enforcement?
Great question. One of the things we'll be doing a little later while I'm here, Monday, Tuesday, is talking to police about all the issues and impediments that they're facing in their enforcement, but just some examples from other places around the world. One is automation, so systems that record the registration plate and the enforcement follows up based on that. But it does require laws that allow that and very robust registration systems.
Right. So that's electronic enforcement. The same system for motor vehicles you would have for the motor vehicle as the motorcyclist.
Exactly.
Right. Okay.
And then the plates, of course, need to be visible, not obscured, and there are other requirements as well. Another one is the way in which the area, the checkpoint, and how it's designed to stop motorcyclists from having the ability to evade it. And it's also talking to police about options for that in next week.
Okay, well, we're going to ask for the report on that as to what they have agreed to implement to help them with enforcement. I just want to thank you all very much for your participation and for the sharing. And if we could just end with the video. This is a precursor to the Helmet Coalition program. Colonel Price spoke about it, where we came together. And it's one of the most beautiful experiences, even though we had to get up 4 o'clock in the morning to hop on a JAA bus, some of us, and the police had to leave from Kingston loaded up with stuff, cones and that sort of thing. But it was a coming together of the Island Traffic Authority, HAT, NSTA, JAA, Road Safety Unit. Did I say ITA? I could say it twice because your people were very supportive. And when I heard yesterday them talking about really the psychological part of how you reach to people, how you get them to change, we really try to embody that. So I always open the sessions, and I don't mention anything about wearing helmets, that's not how I start. I start, what would you like to do, a couple years from now? Would you like to see your daughter or your son graduate? So I made it personal. And then they all had to wear a T-shirt on the second day. The first day they would come in without helmets, without T-shirts, but they would have to come dressed in a particular way. We had I'm a safe biker, life matters. And they would have to keep repeating it. And of course, it got very robust because, let me hear you, let me hear you. So there was a sort of, we sort of tried to get a certain atmosphere to be able to engage them. And it was the most beautiful thing to see them with the police. So at the community level, they took a while sometimes to come in, but once they came in, we said, listen, we're not checking your motorbike, we're not asking you for your papers. We're here to share with you, to see how you can. Part of, ACP is here, is that the police would simulate a road environment. So we always had to find a school that they could lay out the cones, and they would teach them to stop, to corner, to turn, to brake. And if they passed that test, then ITA had agreed that they wouldn't have to repeat that. So we would advance them. But we couldn't advance them with the literacy to take the road code. So after this, the Helmet Coalition, the project is over. Of course, we have to think of how to institutionalize. So the National Road Safety Council has engaged HART NSTA, and they have actually prepared a program so they can institutionalize it within their operation, because we really couldn't continue doing it how we were doing. So it's to be institutionalized. So good work here with the Helmet Coalition to get the helmet on, but it has to continue. Could we have the video, please, which will demonstrate that training program? I hope it will play.
We are gonna make it. Win the prize and take it. We are gonna make it. Four corner, global. Tell them so we bless. Tell them 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 so we still have life. We no
see the amount of motorbikes.
Shine on wheel, you know what quest. Screw where your man want pray, we no press. Bless up who down when we for the rest. Tell them we no block like God and we no this. Only follow we like me, so they my guess. How come we still look clean and them a mess? Eventually they will see who is watching over me. Make we shine like stars above.
Original. That's a policeman who is now deceased, unfortunately.
Look, you fit like glove, say life there. We just strive and a reach to the goal. They will fight and a spite through them in control. They will real asshole. But a long time, we a fight for your slice of the bread. They will scheme and a dream and a wish we fi dead. But I got down we dead. I know just now, we a scream and a cheer for the team. Them a plan out for bench and them rule supreme. Like and them want for clean. Well imagine, we a try move out of the shop. Them a cry and a spy and a try stop with clock. But guess how we want for back. Tell them so we bless. Tell them 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 we bless. Now see me spend my last to impress. Tell them me no waste my own, me invest. Make them know me girlfriend want put in verse. Tell them me still look fine. And me still am blow them mind. So you now see me pressure no man like some piss. No sir, we make our own a success. Now hesitate to protect we interest. Stay focused, we are fight for progress. We are saved by for life matter. We a man want to be careless. And this me want you digest. We are strive and a reach.
This is a foot brake court. Don't let use your handbrake. Till you stop it at the exit.
But a long time.
Okay, so that was our effort, and I want to take the opportunity again to thank all the players who were involved, and thank you all very much for participating. The work continues, but we are encouraged at the National Road Safety Council. Thank you.
Thank you so much, Madame Fletcher, and I ask that you remain as we invite Aggie to come forward and provide you or present tangible evidence of our gratitude. Thanks for that video, Madame Fletcher. Thank you so much for that video. It was good memories of that motorcycle instructor, that police officer, Sergeant Usander McFarlane. He taught me to drive a motorcycle. And the training sessions were some of the most fun sessions in terms of the challenges and him speaking us through how to safely handle the corners and going through. Yes, Mackie taught me. Mackie taught. As a matter of fact, he taught hundreds of motorcyclists across Jamaica. Yes, over 100. And we say thank you again, and we ask you to come forward for a group shot before. Please stay, Aggie. In the meantime, ladies and gentlemen, you can see the lunch service has already begun. We invite you to enjoy, and we hope that we'll have a shortened lunch so that we can be back together for the closing segment of our time together in just about 20 to 30 minutes. Thank you for your attention. Ladies and gentlemen, we are just about ready to continue the program. As you continue to enjoy lunch, we're making this part a working lunch. And this part's not too difficult. So we've had the benefit of our experts with us from the various panels. Not all are with us at this point, but some still are. And while several of them were captured prior to now by members of the media that had the opportunity to speak with them and have other interviews and have questions answered, we do have this designated as an official Q&A section. So even if you are not a member of the media, but you do have a question, we are now ready to accommodate them. So if you have a question, raise your hand and we will take the microphone around to where you are. It really has been an excellent 2 days, and I think most, if not all, questions have been answered. But there may have been one or two areas that you would like further clarification, and we're providing you with the opportunity. No, she didn't have a question. She was checking the microphone. Wow, we have a question. Woo!
Okay, one question.
Could you stand? Could you, so we can see?
Hi, Gail Holt from Carrimack. One question. So there's been a lot of talk about enforcement, but there has also been a lot of talk about addressing beliefs, addressing social norms, and so on, addressing culture and subcultures and the importance of engagement. Just one question with respect to communication and engagement. The last video that we had from the panel was a really nice example of community engagement and of a measure that involved engagement and meeting people where they are. But in the grander scheme of things, especially based on what Mr. Fletcher spoke about so eloquently in terms of reaching people where they are, what are the plans for the coalition in terms of communication and engagement to support the enforcement measures that are clearly planned for?
And let's see, Claudine, would you like to take that one? Microphone coming across to you. That's an excellent question and perfectly positioned at this point in the life of the coalition. Go ahead, Claudia.
Absolutely. Thank you. Thank you so much, Gail, for that question. And as you asked the question, I was looking at Omar and Sidoni and wondering if you were eavesdropping in on a conversation that we were just having with respect to community engagement in an authentic, relatable, and effective way. As you say, meeting people where they are. The need for that was something that the coalition identified pretty early. And having had the thought, we held some focus groups with bikers to ask them just how we could do that and do it in a sustained way that would create behavior change and also allow us to measure it. And we gathered lots of ideas and so on, and we did create an action plan which required us to work with some communication professionals. We threw out a request for proposals. I won't say that we were thrilled with everything we've gotten back. I think we may need to go back to the market, because in everything what has been missing for us is the part about the engagement on the ground. What happens in the communities, what happens in the spaces where bikers gather, and how are we going to use those platforms to bring home the message in a way that behavior changes. We also found missing in some of the things the leveraging of the circles of influence that bikers have, be it those personal relationships, the professional relationships, and so on. So we felt like there was more to do. We do have one proposal that we're looking a little closer at, because we feel that maybe we could work with them to get ultimately what we want. But it is in mind. We're on a journey to getting there, to making a decision. We've discussed it. And we hope to be able to actually execute with the right partners this year.
Thank you, Claudia.
Okay.
Go ahead. Do we have other questions? So that's the kind of question we like, because it allows us to showcase the work that has been done over the last 12 months, thereabouts, and it's a lot of background work, which this is also a part of before we step out with our major messaging. Do we have any additional questions? We know.
Hi, I've got one. I'm sorry, Sam. I'm going to ask you a question. Put the spoon down. TransAid, the organisation Sam represents, does a lot of work on the ground with boda riders who tend to be in quite closed groups. They have gathered organisations called SUCCOs, and they have incredible community movement together, which isn't necessarily that outwards and open. And I'd be curious to hear a little bit more about how you can track movement and track engagement in quite close communities of riders where they're not necessarily that keen on going too far outwards and engaging with communities outside.
Thank you, Kate. My name is Sam from TransAid. I think the most effective way that we engage with riders in Kenya is through, we have equivalents of Mr. Marlon Fletcher in Kenya. We have a number of them. In fact, I think I mentioned this in my presentation. 2 years ago, it was made mandatory for riders to become members of associations, which, while it's sort of probably a mechanism of control on the part of the government, it's actually a really handy way of organizing what is a very informal sector in Kenya, very, very chaotic. It does bring some order to that sector, and it provides sort of very clear channels through which we can communicate and get our messages out to the riders. I think Marlon also mentioned social media, which is a very important thing. TikTok is very big with the Kenyan motorcycle riders, so we use that a lot as well. The one thing I think we've had to be quite careful with in using the associations as a means of involving riders and communicating with them is that they are quite political as groups, and many of the heads of those associations do have very, very lofty political ambitions. And so you naturally have to sort of not get involved in the internal politics there and try to stay as well clear as possible. But it's an important group, and they're all important groups and ways to communicate.
Thank you. Allowing the opportunity for one more. Even if the question occurs to you after today, we welcome the queries, we welcome the opportunity to clarify, and we love the way that questions force us to think around issues and help us to look at things from different angles. So you can always contact the coalition with any questions, queries, suggestions that you have subsequent to our time together. And we have our final question.
Hi, good day, everyone. I've been here from yesterday. It's a very informative conference, and I've learned a lot. But something came to mind. Persons that are involved in accident on the bike and didn't have on their helmet, they got injured, recovery, but yet they still ride without the helmet. So what message can we give to them to say, listen, you have been through the experience, you have been hurt, but yet you still refuse to wear an helmet. What can you do at that point? Because they have made a decision that it's not cool, or they don't want to, or as one of the presenter, it's a short distance, so I don't really need to put on my helmet. But yet they have experienced some trauma from not wearing a helmet, and they still decide not to wear it. What can we do?
I think that's one of the questions that we are in the process of exploring to get answers from the experts. And we're going to ask a rider himself. There you go, Marlon.
Yeah, thank you for your question. It's a very good question. Funny enough, I was talking to a gentleman the other day, and he was totally against helmet. And I asked him this question. I said to him, I say, you ever bend down under your cupboard and look for something? And lick up your head when you come out back? Him say, yeah. I said, hot, don't. Him say, yeah. I say, how fast were you going? How fast were you going? So I say that to say, and I continue to say to him that if you lick up your head on a cupboard and it was so hot, imagine impacting a stable object like a concrete at 60 miles an hour. You know, we have to educate the bikers, and a lot of them crash without a helmet, and their lives are spared, thank God, and they continue to do it. But until one of their loved ones, and this is a very important part, one of your loved ones speak to them, we have to take a family approach in dealing with them without helmets, because sometimes they don't listen to their peers, but they listen to their sons, their daughters, their wives, their mother, right? And sometimes you would have a family member in the household to say that you're not go back on the bike without a helmet, you know? So it's an uphill battle, and we're fighting it, and I guess we will continue to fight on.
We will, and a part of what the research that Claudine spoke to is finding out the answers to those questions. What are the things that will help convince them to change? And then we'll have the experts tell us how to apply that behavior change. Claudine, you'd like to add?
And just to complement our own efforts with delving into those kinds of issues, we have started a conversation with the University of the West Indies, the Department of Psychology and Sociology, is that right? To look at the social side, you know, what causes a man to choose, even after being hurt, to choose not to protect themselves. And there are many issues that influence that has nothing to do with a motorcycle. It is the environment, other things happening to him. And as my admired friend, Professor Herbert Gale, will even say, a social anthropologist at the university, he will let you know that decision making like that starts from even how, whether you're breastfed or bottle fed, how you're nurtured. And all of those factors create somebody who will act differently depending on the circumstance. So we have started conversations with several teams, and what we want to do now is to take it from the conversations into action. That's where we are now along the journey. So look out and try to be a part of it. We're here, you know where to find us, right?
Doctor, we have a final comment here.
All right. As I mentioned earlier, I treat a lot of these motorcycle injured patients. You have situations in which the persons are on the ward for several weeks waiting on surgery, and then they take months to recover. And even before the motorcycle injury has healed, they're back on the motorcycle falling off again. So I really believe that the reality is that we need more effective enforcement to get to that particular population. There has to be a fear of consequence. So Mr. Cliff had spoken to capturing the license plate, photograph, and enforcement, and that's where we really need to go. I can cite a quick story in which I operated on a gentleman for 5 hours, and the 24 hours after I was tired as hell from operating on him, I see him on TikTok. I am a motorcyclist, and of course I love to ride fast. And the other one who I operated on the previous week said, I'm a motorcyclist, and of course I love to wheel in front of police. And the video went on and on. So we have to go on TikTok as well and get to offer counter narratives.
Thank you, Dr. Fletcher. And ladies and gentlemen, we now invite to bring it all together the lead for Environment and Community Development Programs, Omar Wright, to the lectern. Help welcome him.
Thank you so much, Paula Ann. Good afternoon, everyone. How are we? We're good? I'm standing between you and the end of the think tank, but I think we are all fueled up. So mine is the privilege to take us to the end of day recap of day 2. So let me first say thank you so much for coming on this journey with the National Helmet Wearing Coalition. We started this journey yesterday, and we wanted at the end of the journey to be fueled to act. And I can say that we are all fueled up with the knowledge exchange that we've had, the dialogues that we've had, and even just now, the questions and the answers, and maybe even not answers, but some of the things that we're going to look forward to. So here we go with the end of day 2 recap of the Heads Up Regional Think Tank. Day 2 started off with the opening recap done by Sidonie Preddy, or Lead for Youth and Education Programs at JN Foundation. We also saw the symbolic signing of a partnership agreement between the Jamaica Constabulary Force and the Global Road Safety Partnership. We had a keynote presentation by our Chief Medical Officer here in Jamaica, Dr. Jacqueline Biseso Mackenzie, and then we had our panel discussions. Panel 4 of the 5 panels that we had over the 2 days was our panel looking at social and economic impact of motorcycle crashes here in Jamaica. The panel unpacked the social and economic burden of motorcycle crashes in the Caribbean. It also explored how helmet safety impacts public health systems, national productivity, and families. It was expertly moderated by Dr. Paris Loayi. The panelists, we have some of them still remaining in the room, and I'll ask you, as I mentioned their names, to give them a round of applause again. Dr. Kerry Fletcher, Dr. Rory Dixon, Miss Elisa Rodriguez, and Miss Adrienne Pinnock. Panel 4 explored how motorcycle crashes and fatalities hindered national development, as I said. While several countries, and we heard from some of the experiences of the Dominican Republic and Jamaica, have identified gaps and areas that needs improvement, there are also some recommendations. One of them being a regional feasibility study, as well as continued monitoring and evaluation so that we can track what we are seeing with motorcycle crashes as well as near misses. Then we had panel 5. Panel 5 explored how creating safer motorcycle drivers can lead to better road usage. And that panel was expertly moderated by Paula Fletcher from the National Road Safety Council. Can we give her a round of applause? And the panelists were Frank Fortier. We could give him a round of applause in his absence. And I am happy to report that he made his flight. We also had the National Helmet Wearing Coalition member, Marlon Fletcher. We had also Colonel Daniel Price. And not to be left out, though he missed his panel on day one, he was so agile. And we had Dave Clifford rounding out panel 5. Can we give him a round of applause? So panel 5, as I said, it was the best practices and solution for motorcycle drivers, and they examined the root causes behind unsafe riding, lack of training, licensing barriers, misinformation, some of the myths. We heard Marlon exposing some of those myths that motorcycle drivers, especially here in Jamaica, has. They spoke of the challenges with affordability or the perceived challenges with affordability, and it was agreed that solutions must go beyond education, but we need to get into the communities, and I heard it coming out in the discussion just now. So with that need for community engagement, we must go beyond even just saying that they have a license, so we need to continuously test and retest. There are some key recommendations from both of the panels that we had this morning into the afternoon, and I'll list those recommendations now. So key recommendations from panel 4 and panel 5. 1, develop a regional helmet standard toolkit. This should include infographics, situational analysis guidance, and helmet testing protocols. 2, advance regional certification infrastructure. Establish a Caribbean-based helmet testing laboratory to assess and reduce costs. Create a regulatory framework for pathways for importation control, and that is to ensure that whatever comes into our port of entry, that they meet the specifications. 4, design authentic public awareness and engagement campaigns that are crafted culturally relevant, that will resonate with the target audience. So motorcycle drivers should be able to understand what we are saying to them. They should be able to interact with the information that we are delivering to them. And importantly, coming out of the discussion, messengers matter. So it cannot be that we're speaking to the motorcycle drivers and we are not the correct messengers. So tapping into the circle of influence, speaking to the persons who influence motorcycle drivers. It's important to develop targeted messaging for the biking communities, to communicate the life-saving value of wearing certified helmets, and to ensure that whom we're using to communicate those messages, they are trusted sources by the biking communities. Another recommendation, strengthen post-crash care systems. So we heard from the Disabilities Association of Jamaica, as well as we heard from the one of the rehabilitation centers here in Jamaica. And the recommendation was to have a comprehensive, integrated approach to post-crash care, combining rapid emergency care, rehabilitation, mental health services for victims, and not only victims, but family members. And finally, establish a reliable data collection system to improve data tracking on the socioeconomic impacts of road fatalities that will later support evidence-based policymaking and intervention actions. Ladies and gentlemen, we have had... Let's go ahead. And we captured that recommendation in the culturally resonant and inclusive training for motorcycle drivers. So we have that recommendation as well. So these are some recommendations that we have here. We'll definitely have more details. As we close this milestone event, we do so with renewed purpose and fuel to act. Advocate boldly for standardized testing. collaborate across borders for greater impact, transforming lives through policies that make certified helmet use the norm. Thank you for coming on this journey over the last 2 days with us. Though we have covered much ground through dialogue and knowledge sharing, there remains more work to be done. We encourage each individual here today to make a personal commitment to act, advocate boldly for standardized testing, collaborate across borders for greater impact so that we can transform lives and make helmet wearing the norm. Thank you so much.